I wrote this morning.
There we go.
Okay, it's 1:06, we are going to start the afternoon work session of the Lake County Board of County Commissioners. Thank you, everyone. Let me pull up my agenda real fast, sorry.
Oh, I know, cause obviously I can't.
That's new. Sorry, I'm totally looking at your screen.
That's fine, you can look at my screen all day, cause when things go wrong, half the time you're like, oh no, you need to do that, can you help me?
No, I'm sorry. Wandering eyes.
Sometimes when I've seen that screen before, and sometimes I just need to open it up again, and, okay. We're gonna start with presentation and overview of the Summit Community Care Clinic and the support they provide to Lake County, led by Jesse Carajat?
That's a great job, yeah, Carajat.
Carajat, okay,
Heard
thanks.
much worse.
Okay. The Chief Operations Officer, and Sarah Dayton, Director of Strategic Operations and Development. Thanks, guys.
Yeah, thank you guys. Well, yeah, so you just introduced us. We are with the Summit Community Care Clinic. And we really want our time here more to be a discussion. We kind of want to share what we're doing here in Lake County and kind of our vision and what we're kind of hoping to do in the future. But we also really want to hear from you guys of where there's needs. Feel free to ask questions, and then we just really want this to be more of like a partnership meeting almost, more than a presentation. So, yeah, were any of you guys here a year ago? I came here about a year ago and did a presentation.
We were all three of us.
I was gonna say, like, you guys all look super new.
Yeah.
Okay, so just to give a little bit of background of who we are, so the Summit Community Care Clinic, we started off in serving primarily Summit County in 1993, but we moved into Lake County, I think in 2015, I believe. We started 15, we started there's a school-based health center at Lake County High School that we started operating, and then in 2016, we started operating the Lake County Dental Office, which is just right down the road. And then just 2 years ago, we started providing primary care and behavioral health services out of Lake County Public Health Office. So we've been in the county for over a decade now. And so we started in Summit County, but we're way bigger than Summit County now. And you guys are near and dear to our heart. We serve a large percentage of population of patients who are from here. So just a little bit about us. We are a nonprofit. We are a federally qualified health center. So that essentially means that the federal government recognizes us to provide services to all, no matter their ability to pay. So we do receive a little bit of federal funding, which is super helpful. On our big budget, it's only like 10%, so it's not really our bread and butter, but it does help a little bit. We provide comprehensive primary care services, dental, so that includes cleanings, restorative, dentures, everything from beginning to end. And then also counseling services. So we have here in Lake County, I believe we have 3 counselors at the moment, 2 that are in the high school and 1 that serves adults at the public health office. Across Lake County, Summit County, and Park County, we have 18 offices, which as I mentioned, 3 are here. So any questions just about who we are, general?
Oh, don't get us started on questions.
Well, that's what we want, that's why we're here.
I'll hold them.
I'm already starting to write down what I'm gonna ask.
Yes.
When we have more.
Time comes to it.
I just wanna make sure you're not gonna answer what I'm gonna ask.
No, that's valid. Here, I'm gonna move,
You can just make it a tiny thing.
there we go. Well,
Just click the little.
oh, there you go.
Nice mark, yeah.
There we go. Okay. So, just a little snapshot of who we see who are Leadville patients and just a little bit about them. So in 2024, we served, averaging up to around 1,800 residents from Leadville. And if you look at the most recent census, that is almost 67% of Leadville's population that we serve, through all 3 service lines. So, some people only see primary care, some only see behavioral health, but some see multiple service lines. So then, on the grand scheme of all of our patients, about 17% of all of our patients are from Lake County. Just to kind of break down the patients that we see who are from Lake County, so specifically just looking at your residents, about 48% of them live at or below 200% of the federal poverty level. I didn't really mention this earlier, but we, as a federally qualified health center and as a nonprofit, we have a sliding fee scale where anyone who is at the 200% and below, they qualify for discounts through our programs. And so, for example, if you're 100% of FPL level and lower, I believe all medical visits are like $20, for example.
Wow.
And so then the discount is based upon income, and we have an application, and that carries across all of our sites. Each service line kind of has a different pay structure for it, but we have those discounts. So about almost 50% of your residents that we see qualify for that program. Yeah.
Lake County Care Clinic patients, and then I see it listed as 1758 Leadville residents. Are we differentiating between within city and county on this?
We're looking at zip codes. So for
Okay.
anyone, yeah, I guess I should have more split Lake County, not
Okay.
necessarily Leadville, but I was looking at the zip codes that are in Lake County.
Okay.
Do you mean households served? Because
Yeah, 'cause that's
1700
less
is not
than-
67% of our
Those
Maybe
are
it is.
individuals.
Maybe that's in
We
city
have,
then.
we have 7,200 people in our county, so.
Oh, maybe I did just look at Leadville then, cause I looked at you're probably right, I looked at
That's right.
Leadville census.
That would make
So I
sense.
did not look at that's a good
Yeah.
point.
Yeah.
So yes, so that
Just
actually
want
be
my,
interesting.
stats are amazing tools, I just wanna make sure
But-
I'm getting your stats right,
No,
so
that's
I
valid.
don't misinterpret anything.
And I can look back on that 1758 and just find out which zip codes I used for that, because they're,
We only have one.
oh,
But if
So-
you look up Leadville census,
Oh,
that'd be
that
different
makes
sense.
from-
Okay.
I think they gave you
Yes,
the
yes,
city,
yes.
the city itself, not the county.
that makes sense, okay,
So
okay.
how would we adjust that percentage there then? So it's 1750.
So I was looking at Leadville census versus Lake County census.
So-
That's an accurate data point,
Mhm.
it's just that is
You
not
just
our
put
entire
city,
county.
city of Leadville residents instead of Lake County.
Well, I divided that percentage, or the 1758 by like 2,300 or so, cause that's what the Leadville census is.
Right.
But if the Lake County census is like 7,000,
7,500,
so then that percentage is obviously,
23%.
yeah, there you go, there
Okay,
you go, yeah. You can kind of see, so again, about, we do serve a lot of patients who are uninsured, and about 44% of our Leadville residents or Lake County residents are uninsured, then also another 26% have Medicaid. You can kind of see through the chart, it just kind of shows you a general, like, our visits of Leadville residents versus total patients, and you can see there's just been an incline throughout the years. Just to kind of have a little snapshot of that. I've already mentioned this, we never deny access to care based on the patient's ability to pay. So we'll never turn someone away, never not schedule them, no matter if they can pay or not, or they have a bad debt or whatever. Yeah. Moving on, I've already kind of mentioned these, but this is just a little breakdown more of each site. So we kind of distinguish our site that is located within Lake County Public Health as our Lake County Care Clinic office. In 2024, we served 518 unique lives there, and that accumulates in 966 visits. So currently, we're open 2 days, as of like today, we're open 2 days a week for primary care and 3 days a week for behavioral health. But in April, we'll actually go on to our expansion in a moment, we won't go there yet. At the school-based health center here, so we are technically in all 3 schools here, but we technically have an official school-based health center at Lake County High School. Essentially, the federal government recognizes them all as sites. The state only recognizes school-based health centers when there are all 3 service lines provided. And so because of that, technically Lake County High School is our only state recognized school-based health center, because that's the site that has primary care provided at it. But we do provide behavioral health and dental services at the elementary and intermediate school. So we are in all schools, but you can see Lake County High School, we clearly see a lot more patients there, and that's primarily because we do have those primary care services. Within the 4-day school week, we have a service line there every day of the week. I think primary care is there 2 days a week, I think behavioral health is close to all 4 days, and dental is typically 1. Yeah, and then also at our Lake County office, just dental office, just right down the road here, we have served 964 patients there in the year of 2024. Yeah,
Me, I'm one of them.
cool, hope you
I love it.
So we're gonna talk about the expansion that Sarah just kind of set the stage for. So regardless of the specificity of the statistics, what's very clear to us is that we're serving a lot of the people that live here. And we see that data on our end in Summit County too, so a lot of folks are commuting from here to there to get the care that they need. And we have 3 pillars, and I know any organization should have some operating pillars that matter to them. We stick to ours very, very diligently, and our pillars are access, stewardship, and quality.
Yeah.
And from an access standpoint, the fact that we know that your residents are driving that far to get their care matters to us, so we wanna make a change. So effective actually, in April, we're going to move from 2 days a week of primary care to 5. And that's a big change from an access. Yeah, so we've been working, of course, yes, but we've been working really hard behind the scenes. You can imagine with an entire medical team having to staff that and the equipment and technology and everything that we have to do. But it's been in the works and things are going great. So effective on or around April 1st, we should be near that 5 days a week coverage, which it's a big deal. And we're doing it because we just wanna meet people where they are. When you think about yourself, I mean, the inconvenience of having to drive that far to get the care that you need, it hurts families, it hurts people, and sometimes people won't get care because of that barrier. So we're taking the steps that we need, and it's coming fast. So we are still working through statistics and putting together an operational plan to make sure that we safely and effectively launch this expansion, but 100% it's happening, and it's happening soon. So
Great.
yeah, and we're gonna be, with that, also, we wanna get the word out amongst the residents. We're gonna have a marketing plan for that and find ways to reach them, to let them know, including let them know at our office in Summit that they can also now receive care here if they don't wanna make that commute. If for any reason, I know some people work in Summit County, maybe it is more convenient for them to stop in at the doctor's office on the way home or to work, etc. That's fine too, we can meet them there, but we just wanna have an option for them to actually get the care that they need where they live. So we are planning and preparing for that real soon.
Yeah.
So,
Great.
alright, yeah, we're really pumped to give you that news, so.
Yeah.
Any questions around that for now? Cause we have another exciting update.
Your funding seems so secure. How are you finding such secure funding right now?
Well, I don't know that I would describe it as such, as an QHC, we have to be diligent, we have to spread things around and try to meet people, so we're making it work, but we could always use some help, I'll say.
Okay.
Yes.
We can talk about that, and what that could look like.
I think it's worth just giving a little snapshot of our funding, of how generally our, how we work in general. We are fortunate, we're unique in nonprofits that we can collect insurance. So Medicaid provides us reimbursement as well as private insurance. And so most nonprofits are fully reliant only upon what they can get in grants or donations. So about of our organization budget, about 50% of it is raised through patient revenue, which is great. And then the other 50% is primarily through grants and donations. So that's actually part of my role, is I help with the writing and management of grants and then supporting them, and the implementation. And so we have about 7 million in grants annually, and we rely very heavily on them. But we do have a very robust grants team that, so kind of as Jesse alluded, we are always interested in help, and that's actually kind of one of our questions here is, what do you guys know? Because of course, expanding here it's been something that we've, I feel like even the little cheer is so showing that people want us here and that it's a need here, but how do we actually financially sustain it here, especially in the midst of its growth. But at the same time, we're also working diligently to figure out where we can get grants whenever we can.
Yes, okay.
Yeah, are we ready for the next slide?
Yeah, I'm ready. So,
Yes.
it is rebrand week for us. The timing of this meeting was serendipitous.
This is quiet, guys.
For another couple
No one
of days.
knows yet, you're the first.
Yeah, so we've been also preparing to launch a rebrand across our entire organization. So, Summit Community Care Clinic is an amazing name and it served us well, but we've expanded outside of Summit County. We're in Lake County, we're in Park County. So one of the reasons we feel that a rebrand is necessary and needed is because Summit Community Care Clinic no longer kind of represents who we are and more importantly where we are. So we wanted to broaden it up a little bit. We also wanted to modernize our logo and our branding. I think if you take a look at it, again, it makes you feel warmth and a connection to us, but also we don't have a modern brand and logo right now, so if I had to pick a second reason, we just wanna have a modern one that is more appealing to today's person, right? So I think modernizing was important to us. And then we wanted a name that was emblematic of quality. I mentioned our 3 pillars, quality is one of them. So elevated, and we polled internally, we polled patients, and we had much debate about it, but we felt elevated as kind of like a leading word, communicates what we're trying to convey, which is we're about quality and access and stewardship, which are the other pillars. So this is our new brand name, this is our new organization name. We are announcing it more publicly this Saturday at our soup event, which will be my first soup event. I don't know if anyone here has ever been, but it's a great night, a gala celebrating the community, celebrating the organization. It's a fundraising event that Sarah and her team is kicking off. So we're gonna launch it on Saturday, and then Monday, it's gonna be official, it's gonna be out in the open, out in the wild, so.
Some new signs pop up on all of our sites here and so on.
Is that a graphic of peak 1 and peak 2?
Yeah, it
Line
kind
first
of
go.
is, yeah.
Good call.
Yeah, we were like, it'd be cool for it to be like mountains around here and not just, cause when you're around here, my husband grew up here, or in Summit County in particular, and he can literally see any photo and be like, oh, that's this mountain. Remember, and I always thought it was so weird until I moved here, I was like, oh, it's so true, people recognize the mountains.
Yeah,
So, either way.
good call, yeah.
Yeah,
Not
so
wild there.
we know that we're sharing it with you early, and we know that there's a chance we could get out, but if possible, try to keep it under your hats until the 29th.
We've got an extensive operational plan behind the scenes, make sure we're communicating it proactively, our website's turning over the physical signage at the locations of schools, so again, a lot going on, but yeah, it
You are
should be.
being recorded and posted on
Yeah,
YouTube.
I'm aware.
That's alright.
It's calculated.
YouTube is, I don't know how fast that happens.
24 hours.
It's okay.
We can deal with a couple days, but if the cat got out the bag a month ago, I think that'd be.
Yeah, exactly.
This feels like such a crucial step for you all. I definitely, even as a fairly aware consumer before, I did not understand if Summit Community Care Clinic was for me.
Totally.
So this is awesome.
Yeah, and it really fits right into this discussion today, because
Yeah.
we're talking about expanding and represent who we care for, and we care for this county, and
Yeah.
these residents, so yeah, we're excited about it, and anxious and nervous and all the feelings, but.
Oh yeah, our to-do lists are long
Yes,
right now with it, but it's great.
alright, so now you know.
Yes.
And then, lastly from me for now, if you don't know, we're actually in the works of a renovation project at Lake County High School. Has anyone ever seen our school-based health center there by any chance? No? Okay, when you walk in, and it's serving families and it's serving the kids, which is great. But if you walk in, you can see an opportunity to just kind of improve that space, some privacy for our dental team, just a little bit more kind of a flow and just some more, rooms and innovation. So we're aware of that. We've got some great ideas from some broader SBHC organizations that kind of informed us. So we're in the early-ish stages of moving forward with the project to improve that space for the kids, because we can also serve the kids' families there as well. I'm not sure if you're aware of that. So we just want to make sure we're being intentional, not just expanding the main claim that we have here, but also the school-based health center as well. So I don't know if you want to add anything.
Yeah, just to add to, we did get a grant that's able to help support this renovation. And so we wrote it with support of Lake County School District. So they've been engaged in the conversation from the get-go. And so we're working closely with them right now to figure out what to do. And part of the grant, or part of our goal to it, is that we could be able to offer restorative dental work there in the school. A big gap that we've seen is that we in our school-based health centers, we primarily provide dental cleanings, fluoride varnishes, and sealants. But then if a kid has decay and really needs a lot of like a cavity filled or dental procedure, we typically need them to go to our main office for that. But we have noticed that there's a bunch of kids at Lake County High School who have a lot of dental needs and just simply they can't make it to our dental office. And so upon the renovation, like Jesse said, it helped create a private space for our dental team essentially, because right now it's mostly temporary walls. And the grant would also pay for us to buy the equipment needed, so that then I believe we want to do once a month where we can actually have a dentist go there and do the restorative work at the school, kind of decreasing that barrier. So that's kind of like actually the original intent, or one of the original intents of kind of moving towards it.
Will students from all of the schools be able to access the dental
Yeah.
care in that clinic? That's awesome.
Yeah, so that's actually a good question. Any school, no matter if you're in the elementary school, you can go to the high school. And kind of the distinguisher of who qualifies, it's as long as you are enrolled in that school district. Cloud City also counts. I don't know if that's actually part of the school district or not. It is, okay, so yeah, it counts. And then any staff members and family members. So even if it's like their grandchild that is enrolled in school, they can be seen there at the school. And visits are never more than $45 at a school-based health center. So it can really eliminate or decrease that financial burden of seeing primary care.
No provision for homeschool kids?
That's a good question. You know, I think if a homeschool kid came and asked us for it, we would likely try to figure out a way. Oftentimes the rules around that are based more on the school district of who they're comfortable letting into their building. But that is actually one of the reasons we wanted to set up the office of public health, just so that anyone and everyone could have access, because not everyone fits that criteria.
Just a quick anecdote too, just to really paint the picture of why we're so passionate about these school-based health centers, back to the families and the convenience that this program offers, right? Think about someone like what it takes for them to take their kid out of school,
Yeah.
carve out, even if it's an hour and a half, to take them out of school, drive them to a dentist and then
Yeah.
bring them back.
Take off
It's
work.
inconvenience, they can
Totally.
lose money, there's economic impact
Yeah.
on that, so just the convenience that this program offers for those families is, it's just so
Yeah.
impactful.
Half the year, you're like, please let it not be dumping that day, you know,
Oh, I
yeah,
great for
know.
Caltrans, bad for commutes.
Exactly, so
And
we'll,
let's face it, for those kids that love school and the dentist, you get to go to the
yeah,
same spot.
Yeah.
There you
Huge
go.
demographic
You
right
can't
there.
get away, you can grab them on the way.
Yeah.
Totally.
yeah, or the kids that don't love school, they get pulled out of class for a second,
Yeah,
they get to
right.
do something
Totally.
else,
Yeah,
whatever
yeah.
works, but just wanted to kind of bring color to, you know, what it feels like to have a child in that program and how
Yeah.
convenient it can be, because we give quality care in everything that we do, so it's not even as though they're compromising what they could receive at a dentist's office, so.
That's great, because the teeth are
Oh, it's important.
the mirror to the
Lifelong
overall
friends.
health of the
Exactly,
body.
it's a window into
Do
your
you
health.
wanna market for us? A lot of people don't know that.
Yeah, it's a precursor to heart disease and
Completely.
halitosis.
Ugh, nobody likes halitosis.
So I'll be the sidetrack.
Yes.
That's good feedback.
Just another upcoming program or project that we wanted to just mention is Heart of the Rockies down in Salida area. They have a grant from the state that essentially allows them to do intentional community outreach to encourage women, specifically uninsured women. Oh, I spelled that wrong, I'm sorry. But either way, uninsured women ages 21 to 64. We both have a program. We have a program to fund free breast cancer and cervical cancer screenings, and they have the same program to do intentional outreach. And so they will be, here the next coming months, they're gonna be doing some intentional outreach, sending mailers out into Leadville residents, or Lake County residents, and, I believe they'll also be probably at events and all sorts of stuff. They're gonna be funneling some marketing dollars in to ideally help those women be aware of these services that they can access, that we can provide them right here in our office here. And yeah, so it'll be really awesome, and hopefully we'll start to use it and access it. So just kind of jumping into some ways to support, as we mentioned, for the finances, and I think that was one question we did have for you guys, is if Lake County government ever does have like grant opportunities that we could apply for, and what would that look like? Yeah, just I guess to start there, any sort of ways that Lake County government is able to support through grants or anything?
Do we already pay the rent there?
No.
No.
We
Okay.
do, we just started this year to ask for a small amount of funding from Summit Community Care Clinic to pay for their portion of the rent. But we cover all utilities,
Okay.
and a lot of the costs there. I do know we have let go of our Title X funding so that you all
Yes.
can seek that funding. That's our family planning dollars that will no longer go to public health, but instead is Summit Community Care Clinic, so.
And we
Happy to
did
continue
get that
that.
award.
Oh, great.
We did, yeah, just like last week or something.
Cool.
Interestingly, the award did not increase from what it was the year before, but we'll do what we do. And we'll provide those services for the county. Yeah.
Any orthodontal work in the future or currently?
So, well, Well, not necessarily, but I think it's worth bringing up the pediatric practice. We have actually been approached, so in Summit County, there is Dr. Malcolm Strange owns and operates the one pediatric, dental practice that is in the entire surrounding area. And he approached our CEO in, December-ish maybe about us taking over those operations. He's, past retirement age, and he's a very sweet man, and he, we literally just had a tour last week and we have been knee deep in those discussions. We're really hoping for our board to officially approve it next week. And
That's
so.
his whole staff and everyone.
Well, we're not going to, hold on to his actual dentists, so a lot of the office staff, support staff.
Okay.
Yeah, and I think they have another office like further out east, where they'll still be working there, but he's really just looking to hand off the practice there, but I think his dentist, his son included, will go, elsewhere more east, so.
So he's like past retirement age, but then also the dentists are all commuting up from the Front Range and they're kind of over it.
Yeah.
Is it the pediatric dental group?
Yes.
Strange?
Yep.
He was my dentist as a child.
No way!
I was like, how many Dr. Stranges are there?
Yeah, not
There's-
many.
There's one, yeah.
Oh my god.
My daughter will
Like
not,
pretzels.
like, she won't go there.
That's so sweet.
That's like, yeah.
I think the closest
I
pediatric
didn't know
dental
that.
Will be
specifically is
Evergreen.
in Vale, I wanna say, I think there's one out that way.
I think it's at Avon,
Is it?
Avon and Evergreen, I believe are like the next closest.
Okay.
Wow.
Yeah, but we're soon, and again, it's unofficial, but it's looking to be official, we're soon to be, the only pediatric dental practice
Yeah.
around, and that was just a God thing or serendipitous thing, how you look at it, but it's just, he came to us and it felt like it was a fit, and,
Wow.
we're going in that direction, so we're gonna be hiring our pediatric dentist ourselves, we have everything ready to go, but we do have to follow, our process internally, but, so to answer your question, that could
does
be,
include ortho?
it could be.
So that's not gonna start right away, but that is our CEO's hope
Yeah.
in the next year to be able to start offering those services in some capacity.
That'd be huge.
You think that's a great need?
Yeah. So that's not official yet, but we're really hoping to move forward with that start next week. And we would take over operations in June, or start operations in June. And Dr. Strange, he's wonderful. He's offered to continue offering his services and under us until we can find a pediatric dentist that he trusts. And he's a sweet man.
He's a good guy.
He's so
Yeah.
sweet.
He actually went from, oh, your daughter needs braces to, oh, you know what? I don't think she's gonna need those. Her teeth are starting to straighten out. I'm like, what dentist is like, oh, you don't have to buy this
Who
super
that?
expensive, yeah, like,
Who cares?
He's a sweet guy. And we're excited about it. So one thing, if we do, hopefully take over the operations, is it would then mean that all the patients who go to that pediatric practice and future ones will qualify for our care card, that sliding fee discount.
Wow.
So that will open up the access for those who previously potentially couldn't afford it in the past. Which we're just really excited about.
Wow.
Yeah.
Speaking on increasing, people who need your services, I think we're concerned about a large amount of people being booted off of Medicaid.
Yeah.
Which I think in our community, I saw one of your stats that said something like 26.1% of Lake County is on Medicaid. I think that's,
37%.
That's
Way
of our
higher.
patients.
of your patients, okay. What is our numbers?
What's your
7% total across the county?
What was it?
people enrolled.
37, okay.
Okay.
So, as people, lose that and, need other services, do you guys, basically, is it on your radar that the floodgates might open up here for people in really tough situations, needing all the help they can get?
But they might already be using you all, but no one will be
Yeah.
able to build a Medicaid.
Yes, so
We don't turn anyone away, and
Yeah.
yes, it's on
Right.
our radar,
Okay.
of the things that are happening, and we're planning on preparing for that as well.
Yeah. Two things we've been doing is we do have a Medicaid enrollment specialist on staff who can literally sit down with folks and help them actually enroll in Medicaid, while they're there at a medical appointment. But then also we just started a system, it's called Point Care, that will run our patients through essentially a system and identify who is, and I haven't truly seen it yet, so I might, hopefully I'm not describing it wrong, but essentially it will help identify people who are about to expire and help them get re-enrolled. And so the thought is that it'll help people from falling off. And so there's another FQHC down in Grand Junction that we work really closely with, and they use it, and it's been like tremendous for their patients to remain enrolled. And so we are hoping to have that. We have seen just the public health emergency ended 2-ish years ago now, so we did see a decline of like an increase in uninsured and a decrease in Medicaid. But I think this actually goes back to kind of one thing that's ironic, is that ironically, because we've been so heavily grant funded, we've kind of already learned how to operate being heavily grant funded. There's a lot of federally qualified health centers that maybe only have like 1 to 4 grants because they have so many Medicaid patients or private insured patients that that's like covering 80% of their budget. Because for us, since it's only 50%, we've already kind of learned how to survive without it. But again, yeah, we are still doing things we can to prep and being intentional to reserve money where we can and be intentional.
And strategically, going back to the rebrand, we feel and we hope that by kind of broadening who we are and how we talk about our services while keeping our focus on quality, we can appeal to people that have more commercial payers and things like that. So from a revenue standpoint, we hope to be able to offset any potential losses and relying on grant funds as well. So we're kind of positioning ourselves to be stable in the long term in that way as well, strategically. So we'll have marketing campaigns to help to attract that type of demographic and that type of person and family.
Diversifying your customer base across all those different categories helps with that.
100%.
Okay.
Yep.
Yeah.
Good question.
So additional to financial support, just like advocacy, we know that St. Vincent's, for example, is adding a mammography center, which is awesome, and we do provide those free breast cancer, or we work with organizations like them or we get billed for the mammograms and so on, but we've struggled to set up that relationship. And so just in general, any sort of advocacy is always welcomed. And then also just use our services. I think that is one thing that, and make sure people know about them, is we have been here for a year and a half for the primary care behavioral health site. That's for everyone, not just for school-based health center staff, and families, but it is something where, there's times where I still think a lot of people don't know about us being here. And so to continue helping us get that word out would be great.
If there's an email distribution list that we've been part of, great. If there's an event happening, let us know. If you could just think creatively about wherever you're getting in front of your residents, if it makes sense to introduce us as well because of our services, we'd love to partner in any way we can, especially now that we're investing in our expansion at 5 days a week, so I think we can meet people where they are.
Absolutely.
Yeah.
How much do you guys compete with the hospital, and is it a conflict of interest? As we had to bail out the hospital last year for $1 million, how much revenue are you gonna take from them? I mean, can you help me understand like how that's gonna affect our hospital, cause you have overlapping services, and if we start sending people to you, it might be hurting our hospital, and then we might have to fund that
Sure.
under, you know what I'm saying?
Sure.
Well, the initial, you bring it too, Sarah, but the initial decision was based on folks who were already driving into our clinic in Summit County, which shows that for whatever reason, those people aren't utilizing the services of the hospital. So we're right now, like when I'm thinking about the strategic plan, we're just planning on how do we move those people over to where they live, and of course, potentially pick up incremental families and patients as well. But we're basing it on what we've lived and seen, which is people are not staying in the community or coming to us. So that's kind of the first plan. I don't know that there's any conflict of interest as you put it in terms of our relationship and whatnot. But it's more of an instinct here, but I don't anticipate there being a major disruption. There's an ED, I take it, in the hospital?
We have a primary care.
They have primary care and an ED, an emergency department, which we don't offer, we refer to them anyway. So there could be times where we're treating a patient and sending them to the hospital for ancillary services, emergency services and whatnot. So I see it being more of a collaboration. I mean, we share a building with a hospital system in Summit County, you know, so it can work, but we're not really here to compete, quote unquote, but we're here to meet them where they're living, so.
And you guys met with Andy Dreesen and, or
Our
had,
CEO did,
oh, okay,
just to be very honest with you guys, I think he gave him like 8 minutes of his time.
Andy Dreesen?
Is he the president of St. Vincent?
He's the CEO.
CEO.
But when we had the initial discussions with John Gardner, who was the interim CEO who came in to fix St. Vincent before Andy, he like enthusiastically endorsed the care clinic coming up here. And in all my conversations with Andy, it hasn't been an issue, so it is adding another care provider in the community, similar to, you know, Dr. Lisa and to St. Vincent, but it hasn't impacted St. Vincent's bottom line because the care clinic does provide a service to folks that sometimes, you know, won't go to St. Vincent or that,
Yeah.
based on their
Well,
It's more
socioeconomic
filling a
status.
void instead of a competition.
Or what I've heard from public health is some individuals may have had a bad experience at some, like St. Vincent, and either have decided I'm just not gonna get care or have to go over the hill. So it's been a really great option for public health to be able to refer, like you could go here, you could go here, give people their choice based on where they feel most comfortable.
Yeah.
I would love to know like from where you're at right now, like what type of services are you getting most referrals for, people coming to see?
Behavioral health I know is huge. We're getting a lot of behavioral health. I actually don't know if I know the answer outside of behavioral health. I think one thing that is important to note that is where we often complement hospital systems and just private systems in general is that as a federally qualified health center, we actually get the best payment from Medicaid. So Medicaid is our best payer. So just to throw out some numbers which aren't exact, but general, like so if someone comes to us for a primary care appointment and they have Medicaid, we'll get like $400, while St. Vincent will get $100. And so for them, it is not advantageous to take Medicaid. And so that's why you find so many private practices who do not take Medicaid. Medicaid is a very poor payer for them. But so that is where we can often support each other, where we want the Medicaid patients, they don't. And then private insurance will pay them more than they pay us. And so that's oftentimes that we try to like educate and work with hospital health systems of like, hey, let's have this relationship. And then same goes like, we saw that almost 50% of the Lake County residents we serve have no insurance. And so those are people probably going to St. Vincent's if they went there who probably wouldn't be paying their bills or couldn't afford them. And so they're just not getting that care. And so that is something, again, that is advantageous for them, for us to see them.
If I had to pick one other, to answer your question, if I had to pick one, in addition to behavioral health, which would be the answer, I think there's an opportunity, if I just kind of think through our evolution, OBGYN, if we see a mom in our clinic, and prenatal care, things like that, especially if it gets more like, you know, MFM care things, we would look to the nearest hospital to you know, for that, prenatal care, of course, you know, post-birth, so I think that's an opportunity for, as we kind of step away from focusing on that in our clinic.
So we still won't have that up here.
Yeah, what did you, OBGYN services, what do moms do here?
They go to
They travel,
St. Vincent, Vale Health, where?
yeah,
Yeah.
same, Vale Health, Summit.
OBGYN, High Country.
Just one that,
Everybody up here's got fun stories about how fast they drove over the pass when their wives went into labor.
I had a home birth, so I didn't do
I
that.
went to Denver.
Yeah.
Yeah, wouldn't have made it.
Yeah. What other questions or what are even some needs that you guys are seeing? Because it sounds like OBGYN are services that are not really being supported. Yeah.
I mean, just working with public health will get you those answers the most, and our DHS.
Yeah.
I don't think I have the information either.
Yeah, my view isn't accurately representative of the broader community. You know, I can tell you how many times I've seen on social media or something when someone's like, oh, my tooth, I gotta get this pulled out, what do I do? And the comments bring you guys up often.
Yeah.
Outside of that, it's like, only see what I see. I think the right staff to talk to would be better informative than what I see from myself.
I mean, I know it's a big it would be a huge thing to do, but like, so many people from our Latino community travel all the way down to Denver to be offered culturally competent care, not just like bilingual care. So, like, people travel down there to give birth in culturally competent places, stay with friends, stay with family.
Okay.
So, I would say that's the only thing I'd be aware of that maybe public health wouldn't know.
Sure.
It's good feedback.
Something I didn't really mention this earlier and it just, I don't know, reminded me of it. One thing I do think is special for our Lake County clinics is we have, of our 2 primary providers and our dentists all actually live here. So they are actually, locals, which is awesome. And so I think our 2 primary providers, they're actually part-time generally because they specifically only want to work in Lake County. So that's one cool thing that they are at least locals and who will understand at least what's happening here versus someone who's living in Breckenridge versus coming up.
Commuting,
It's a little
yeah.
different.
That's huge.
You might be interested to know that we have a new eye doctor in town, and he set up an exam room in the hospital, I think in the old hospital. He's a friend of mine, I don't know if he can help you, or he'd love to help.
That's great.
That's
I
cool.
don't know if he'd love to help.
Sure.
There's potential for
There's
We-
potential partnerships there for kids that don't even know they need glasses and can't see the chalkboard.
Yes.
Myself, when I was a kid,
Same
just
here.
thought I was
Senior
dumb.
center needs to know that.
Is his office
It
operating
wasn't
now?
until 2nd grade, and they were like, sit closer, you know, and I'm like, oh wow.
I can give him your contact, or I'm sure the hospital can if you.
We would love his contact. We have a relationship with a optometrist down in Summit County who does provide discounts to our care card patients.
Yeah.
But again, for us to have Lake County residents to not have to commute for that, or we could have a relationship with someone who's local, that'd be awesome.
He's
Love an
also
introduction.
a cataract surgeon, so I don't know, probably doesn't have a
Ophthalmologist instead of
ophthalmologist.
an optometrist.
Oh, so he's an ophthalmologist, okay.
Thank you, Chris. So he said he was doing eye exams.
Well, yeah,
Okay.
they do,
He's
but not necessarily just for eyeglasses, he's actually a doctor of
Got it.
ophthalmology instead of
Optometrist
optometry.
only prescribes
Glasses and
glasses.
stuff, yeah.
Okay.
He can actually cut your eyeballs.
Yeah.
Put a lens.
You should put that on his business card. I can
Well, I got
actually.
your
Actually
eyeballs.
do this.
It's an interesting tagline.
He's a
Yeah,
great-
right.
He's a great guy.
Well, that's good to know. We can look into him for sure.
Yeah, I think an introduction would be easiest if you're willing to.
Sure.
Look us up, it's great, our
Yeah.
emails are on the invite list for this, so
Okay.
you can find us, that'd be great.
Yeah.
His wife just moved here too, and she is she's also a doc, and she does, I'll send you some information on her as well.
That'd be great.
Looking for a job, they live here now.
We would love that. That'd
Can
be
you
great.
send that to me too, so I can share it with the senior center?
Sure.
A lot of folks who need access to eye care.
Yeah.
Yes.
Sorry, Kevin, if you're listening.
Any other questions or thoughts or anything that we can help with?
No, just, I mean, you guys can find our contact info easy enough, but just
Yeah.
please reach out to us if we can help you guys with
Thank you.
anything, you know, funding, whatever, as far as like, you know, grant support or
Do you guys
anything
do like an
that.
official grade process or anything like that?
Granting,
Go ahead.
granting from the county is like highly unlikely. We only do very little grants. In the past, like with ARPA funds, we were trying to pass through a lot of that money.
Sure. Is that?
Like many people, but we we're about to have a process for like letters of support, so
Oh,
I'm happy to do that. It's just very unlikely that we'll be able to have funding available that wouldn't be going to other community nonprofits. But it's worth being part of that, we can let you know when it's
Yeah.
opening.
that'd be good to know.
Yeah, and just coordination, communication, so we know, what you guys are going for, if there's something that, we don't wanna be competing, for things and stuff of that nature.
Also, could be discussing purchasing that building at some point in the future.
Oh, that office from Lisa.
I'll give you a permanent home, you wouldn't have to worry. about whatever could happen in the future.
I do have just like kind of a random question. I remember years ago, I feel like there was a stat that like about like 80% of Lake County residents exited commute.
That's still true.
Is that okay? That was my curiosity.
It's like 78%.
So it hasn't dropped since like COVID and people are working from home or anything.
I don't think it's dropped since the 90s.
There's a lot of outsiders who moved here to work from home. I'd be curious to know if that's number skewed in the last,
Yeah.
since COVID, cause I know a lot of people have moved here that work from home.
It's probably balanced out by the people who moved up from Summit County
Right.
Oh
and still
yeah.
work down there.
And we have a lot of employees who live here.
Yeah. The house next door to me just got bought by someone who works down there, who's lived in Summit forever, and they're like, it's the only place we could afford a house to raise a family.
The electrician who's working with us, on the clinic, the expansion, that's his story.
Yeah.
He lived down there for a while, and he loves it, absolutely loves it here. That was kind of his thing, he said, hey, I'm gonna move somewhere, have a home, have some space for my family to grow out, stretch our legs.
Yeah.
Yeah, so you're probably maybe seeing a lot of that, I don't know.
Yeah.
It grows on
Yeah.
you, like
I
a
can see it.
tumor.
You're on
Yeah,
fire
hopefully
today.
that's
You're
right.
on
He
fire.
said this morning he wasn't gonna crack any more jokes. What would we do without this guy?
It's Tim's last day, we're trying to make it fun.
Yeah.
Oh.
How often does this group meet?
Every Tuesday, Wednesday, Thursday.
How often are we,
At least.
how often are we invited to come and chat?
We initiated our invite.
Yeah.
We asked to be invited.
In the spirit of transparency, if that's important to you, we'd love to come as much as you want us to come. We can
Yeah.
just share what we're up to and we can collaborate, so we'd be happy to do that.
Awesome, thank
Yeah.
you.
Yeah, of course.
Yeah, anytime you guys know how to get a hold of us and we can see when we have gaps coming up, we'll get you guys in.
Got it,
We like to stay busy.
That's awesome.
as do we.
Yes.
Yeah, obviously,
Yeah.
really crushing.
Got a lot of work to do. Alright, well, thank you guys.
Thanks
I
for
think
having
that
us.
was
So
our
much.
presentation.
Appreciate it very much.
Yeah, you're welcome, thanks for coming.
Thanks for everything you do.
Yeah.
Thank you.
Thanks for your partnership.
We'll sneak one out. Do I need to do anything with the computer?
No, we can do it. Yeah.
Have a good day.
Thanks, Sarah.
Thank you guys.
Alright, thank
Alright,
you.
thank you guys.
Okay, do you guys like take a break in between or just right into the next thing?
No,
Keep
we're.
coming.
Actually, I wanna,
Yeah, take a little break. It's like orange on my hand.
I'm just gonna move this out of the way, Carly, so we don't need to get through.
Oh, thank you.
There's so much room, it's so nice.
I actually have the remote work stats from the housing needs assessment. And remote work actually decreased in 2022,
This is your bag.
They want everybody back in the
which is
office.
kind of surprising, right?
Remote work decreased.
I don't have like the most updated numbers, that's the most recent
Yeah.
data that we have, but I would have expected remote work to increase in 2022 when that was still kind of like mid-COVID times.
Well, I would almost feel like that was the end of COVID, when everybody was sort
Yeah.
of starting being forced back into the office maybe
Yeah.
at by 22.
But that's even a decrease from 2016 of remote work, which, yeah, it's just surprising to me.
You know,
Is that your bag?
Yes.
and, you know, 2016's going way back, I didn't even think it was,
Yeah, who could
Established.
even do remote work?
Right. what's
There's cell
Zoom?
phones in Jersey?
Is this a new button you're talking about? Yeah. I'm just gonna keep swearing until someone gets me.
You know, I've always wanted to enterprise studies here.
Okay, hopefully I did that correctly. Your PowerPoint should be there and then the other one should be,
In Acrobat?
yeah.
Amazing, thank you so much for getting this all set up.
Sanders, with that hazard format been up on your end?
It
I
did,
think-
yep.
oh, making sure.
No,
Is it on
the
your notes?
PowerPoint.
Yeah, it's in the articles.
Yeah.
You want me to go grab it? Okay. Oh, yes.
Thank you. Alright, hello everyone.
Hello.
Hello. Thanks for having me today. I think I've met all of you, but I'm Carly, the executive director.
Nice to meet you.
Yeah, nice to meet you. Totally. I'm here today with Christy Galarza, who is a consultant with us through GEM Consulting. She also used to be an employee of Build a Generation and facilitated the Housing Coalition, so you likely know her. And she's leading one of our projects, and I wanted to give her the opportunity to talk about those later in the presentation. Christy, do you want to say anything to introduce yourself?
Hi, everybody. Thanks so much for having me. I have a little bit of a cold, so sorry if I sound a little funky, but I'm excited to meet you all and grateful for all the work you're doing to keep Lake County running.
Thanks, Christy. Cool, yeah, thank you all for your service, for our community. Tim, congratulations on your last day. Thank you for everything you've done for us.
You can just make that team, yeah, you can.
How do I, okay. Cool, so the purpose of my presentation today is to really just give you a history of our organization, some background on what we do and the impacts that we've had over our decades of work in Lake County, and then also talk about our current initiatives and how I see us partnering together. I really think that we have the potential to be highly impactful through partnerships. So I wanted to talk through what that's looked like with previous BOCCs and how that could look moving forward. And I'm happy to answer questions as we go or at the end, whatever y'all want. So Build a Generation, our mission statement is organizing Lake County to build a healthier community. We believe that health is more than healthcare. So are y'all familiar with the social determinants of health?
No.
It's the conditions that impact health outcomes for people. So it's like the work environment, the living conditions, the geographical region that someone might live in, socioeconomic status, all of those things contribute to someone's health and well-being. And so there's 5 social determinants of health, including built environment, social and community contact, economic stability, healthcare, obviously, and education. And the way that we organize community is with the belief that health is all-encompassing and includes all of those things. So an example would be that like housing and affordable housing is a fundamental key aspect of the social determinant of health. And if there's not access to affordable, safe, quality housing, that could result in overcrowding, poor sanitation, which would, then eventually result in things like poor health outcomes, maybe respiratory illness or mental health impacts. So the goal of our organization is to kind of identify the root causes that are leading to poor health outcomes in our community, and then work alongside coalitions that we build to make sure that we're on the same page in terms of like what is the actual root cause. We feel it's really important for us to all be aligned on identifying what the problem is so that we can work towards an impactful solution. Hi, Ben.
Rascal.
What do you do on powder days?
This has never been. Never been.
Snorkel. I need a snorkel.
You don't work here.
He does, they're commissioner support dog.
Yeah, this
Honestly,
works.
he runs around, he's gotten way too comfortable at this courthouse that he just thinks he owns the place. Yeah, it's a bag, yeah.
Yeah.
There's no food left, I already ate it all, sorry bud.
So sorry for interrupting.
This was great, come back.
No apologies needed, send them back anytime.
Yeah, so another way to think about social determinants of health is like an upstream prevention model. We work really closely with our direct service providers like Full Circle and C4, who can do things like utility assistance, rent assistance. They have their diaper program, things like that. Those are all really, really important because people need those services today. But Build a Generation is taking an upstream approach to say, like, what if those issues didn't exist in the first place? What would need to happen so that we actually don't need a homeless shelter? Because people have access to affordable, high quality, safe housing. I'm just using that as an example, but we'll walk through each of our initiatives too. And we also believe that inequity is real, and we believe that inequity is systemic. And so health equity, I know that that's a term that's been like more and more in the news lately, but the way that we define that.
Jim, someone let Emily in?
Oh,
Oh, sorry, I didn't know who was driving.
I'll drive. But please call that out to me, because I'm not used to when we think of health equity, it's just making sure that everyone has a fair and just opportunity to live and thrive in our community. And we see equality as making sure that everyone has the same access, and equity as a recognition that people have different circumstances related to the social determinants of health that will require different supports and interventions. And that's how we define equity, and so we do look at Lake County and see here and elsewhere that inequity is real and that it's a systems problem. We are, I kind of already talked about looking at what are those root causes then of the health disparities that are leading to different health outcomes in different populations. Those health disparities are preventable differences in burden of disease, violence, access to opportunity, access to housing, access to a living wage, all of those things that are preventable and that are systems related that we can intervene on, sort of on the upstream side. The final belief that we share is that change is possible, and we organize community around that premise that there is a lot of hope and a lot of possibility in working together to accomplish long-term solutions. We have a really excellent history of doing that really well in our community. So these are just some like high-level bullet points. I should say, just for context, I've been in Lake County for 5 years. I've been at this organization for 3 years, and I've been in my position for 1.5 years. I am from Colorado, but I'm not from Lake County. I know that some folks in this room actually were part of some of these initiatives that I was not here for. So you actually may know about these initiatives already and may just not have connected them to Build a Generation. The history of Build a Generation. Build a Generation was actually a statewide project, and so there were many Build a Generations across the state that were specifically focused on substance use prevention, primarily in tobacco prevention. And as the state started shuttering those programs, Build a Generation in Lake County worked with public health and the county government very, very closely to say, like, this is actually working really well. We've seen a lot of positive change through this model, and we'd like to continue it. And so rather than shutting down, we evolved and adapted to the needs of our community. And that's how we've continued to operate since that time, in the sense that like we convene community and work at direction of people with lived experience in our initiative areas. So we don't decide like, oh, housing is an issue in Lake County because we feel that way. You know, like we're actually using survey data, we're using a lot of different data sources from the census, from the state, from Robert Wood Johnson Foundation, and then from community surveys to help us identify our priority areas based on what we're hearing from our stakeholders. And that does include county and city employees as well as cross-sector folks from various fields who are interested in our initiatives for a lot of reasons. And once we get more into our specific initiatives, I'll talk about that a little bit more. But that's how this all started in 1996, so pretty long time ago. And we were a project of Lake County Public Health. I just met with the public health team last week, and we were just sharing how, like, in a lot of communities, a Build a Generation doesn't exist. We're kind of a unique model for a lot of reasons, the way that we do collective impact, the way that we do systems change, but our focus areas are initiatives of public health. And Julia and Kelsey were really sharing that, like, this work is public health, and in many other counties, this is work that would be done within the county. And the county right now, like that's a lot of capacity, right? So we're so happy to be able to support the work that's happening at public health with our public health initiatives, and we still work really closely with them. We used to be co-located in their previous building, over on 6th Street, and we are still there, and they're obviously not. Then in 2010, we worked with a large coalition of community members to develop the youth master plan. A lot of what Build Generation does is long-term strategic planning with important stakeholders, so that we can sequentially accomplish the things that need to happen to make sure that everyone can live and thrive in Lake County. We got grant money from LiveWell, and in 2019, we were recognized by Robert Wood Johnson's Culture of Health Award. This was a big recognition for our community. They only gave out 10 across the entire country, and that wasn't just for Build a Generation. The award recognizes our whole community for being able to collaborate, come together, identify issues very clearly, and then work towards solutions that all have a health equity focus. So, let's see, where is this?
That's a big deal. Robert Wood Johnson awards are a big deal nationally to get one.
Is that just a one-time deal or multi-year?
It was a one-time deal technically, but then in 2023, they opened it up to communities who had like won the award to ask them to continue their work in storytelling and figuring out how we can, like, I know how things have felt for me, and I imagine things have felt similar to you. Like right now, it does not necessarily feel like as a community we have shared priorities or a shared vision. Sometimes it feels like there's a lack of collaboration and a lack of understanding. And that's so real. At the same time, like we are actually moving things forward so well. And this award recognizes that, and then in 2022, they got back to us and invited us for a new funding cycle that helped us share what we're doing well so that other communities can replicate what we're up to. And like Tim was saying, being recognized by this national foundation is huge. We've also been recognized by the Urban Institute, another national think tank, as a rural community who has a model to share with other rural communities. And I know that it doesn't always feel like that, but I wanted to share some of the things that we've all accomplished together. Like some of this award was recognizing the work in 1995 when community meals began, the mineral belt opening, the community pool, the community fund wraparound, the public health improvement plan, EDC launching, advocates shelter. I can share, I should have included this, but it's this whole long timeline of all of these initiatives that we've accomplished together that contribute to a culture of health and well-being in Lake County. That is recognized nationwide. And then in 2020, we became our own nonprofit. So we went from being a part of the county under public health to being our own nonprofit. And so there's an MOU that I'm sure you have access to that kind of outlines how that process worked. We had several grants shared together that we had applied for, and so there was a process by which, and I'm sure Chris could answer any questions about that, but all employees of Build a Generation were employees of the county at that time. They were terminated with the expectation that they'd be rehired by Build a Generation under our 501c3 status, and then there was a whole agreement of how much money would be remitted to Build a Generation on what timeline, so that we could like become a nonprofit on our own. And that was January of 2020, and then as we all know, in March of 2020, we had the pandemic, and so we did kind of pivot what we thought we were going to be up to help support our community during that time of crisis, and we helped form the Unmet Needs Committee and facilitated a lot of great work that was recognized nationally and by the state as a really great example of a pandemic response plan. Any questions about the history of that? Okay. So the process by which we do all of these things is called collective impact. And y'all may already be familiar with that, but that's a structured approach to systems change through cross-sector collaboration that establishes shared goals. And that sounds a little squishy, and sometimes it is, but there are 5 principles that have to be present for it to be a collective impact project. So that's, like I already shared, a common agenda with a clearly defined goal, an issue that we've all decided, like, this is the issue and this is what we're working to solve. A shared measurement system, mutually reinforcing activities, so really like coordinated action between collaborating entities so that we're not all moving things forward without working together. And then a backbone support organization, that's a requirement of a collective impact model, and the backbone support organization is us, that's Build a Generation. So that is an organization that has dedicated staff with a very specific set of skills to run each initiative forward. I think collaboration is such a buzzword, and it's hard to know like how to do that well. It feels like, oh, if we're all just in the same room, like collaboration will happen. And I think we've all experienced like that's not really the case often. It's really helpful to have dedicated staff who can move the initiative along, maintain the momentum, build consensus, those types of things. And then system change is addressing the root cause of complex issues to transform the underlying structure. So kind of what I started talking about, how we're looking at those upstream social determinants of health to change the problem from the beginning so that it's not being experienced and we don't have to intervene down the line. A lot of people don't understand who we are or what we do. That's something we experience a lot because it is a unique model. It's not something that exists in other communities. We do get a lot of requests from other communities to help them start something like this because it is so highly impactful. But I wanted y'all to see kind of the various things that I know you've heard of or participated in that you might not have associated with Build a Generation. So we're called Lake County Build a Generation or BAG. And then each of our coalitions, we operate them, we facilitate them, we support them through financial resources and capacity building. But I'll often hear people in like county meetings or city meetings talking about the Housing Coalition, for example, and it's not always associated with Build a Generation. So I just wanted to call that out. These are our initiative areas. These are our initiative facilitators. So childcare is one of our initiatives, food access, the Housing Coalition, and the Youth Coalition, and I'd love to talk about each of them. Yeah, thanks. So I'll actually start with housing and food. Food was our very first initiative. And again, this was when we were with public health. So this was in 2014. The Food Access Coalition started. Their mission is working together to ensure healthy food is affordable and available for everyone. I think a timeline is included in your packet for the Food Coalition, so you can see, and there's a lot of really helpful links if you want to learn more. They published a food access assessment in 2014. They held their first meeting in 2015. And then they started working on various projects and initiatives, and there's a whole timeline of that in your packet if you want to review that. But since then, they've created the Food Action Plan. And I wanted to start with that because it's a really good example of how our coalitions work. It's a strategic plan. Let me pull it up real quick, sorry. That has been developed by community members coming together under that collective impact model to identify the problem and then work through solutions together. So over the years, it started over a decade ago, that group has been made up of different voices, but through various needs assessments, that group has come together to create this food action plan that has 8 strategies that they will be working towards over the next 5 to 7 years, and they'll adapt those as needed based on whatever we come up against. Like right now is a really interesting moment in time where funding for Medicaid or funding for SNAP is starting to look different, and we're having to figure out how do we pivot. And so these plans are also made to be living documents to adapt to the changing needs of our community. But some examples of the plan include supporting the development of new locally owned food and farm related enterprises in the community. And so while we focus on health, we do also feel that the economic resilience of our community is a huge part of those social determinants of health. And so one cool thing that Mara and the Food Access Coalition are doing right now is partnering directly with the EDC to provide resources to help local food businesses or folks with a cottage kitchen business who aspire to have a food business understand what are the steps to actually become a food business. How do you work through the system to actually sell your goods, whether that's in a store that already exists or maybe setting up your own store. And then they're also working on a SNAP outreach pilot to support DHS during these sort of uncertain times. So I really encourage you to look through that strategic plan if food is an area that you're interested in. It really does outline how the coalition will come to consensus around what's needed to get to the next stage of, for example, food access and security in Leadville. Mara Gwynn is the facilitator of that group, and that is her beautiful face. Our housing coalition is almost as old. It was formed in 2016. And that did a lot of foundational work for housing projects that are currently occurring. It really helped run the campaign of 2A to help set up that first funding mechanism to support our regional housing authority. I think I've heard someone on this commission talk about how campaigns are expensive to run, and to pass something like that is really challenging. And so without the Housing Coalition support, which was, a cross-sector group of folks who are interested in affordable housing, the Regional Housing Authority would not exist or would not have existed at the time that it did. They also supported CNU in acquiring their park. It was one of the first resident-owned communities, so as I'm sure you all know, folks who live in a mobile home park own their house, but they don't own the land under it, and it leaves folks really vulnerable to predatory landlord practices, increased rents, poor water quality, those kinds of things, and they're not building equity. And so there's a movement across the state and the country really to help residents of mobile home parks become the owners rather than having the property management company. And this CNU is like the one right by Family Dollar. And the owner actually wanted to work with the community, so it made it a lot easier to facilitate because otherwise it's quite challenging. And Build a Generation was the community organizing body that helped move that process forward. There's a lot of complicated things to understand. There's a lot of money on the line, and our organizers helped that become the first resident-owned community in Lake County and one of the first in the state. Those are just a couple examples. And then the Child Care Coalition is facilitated by Cruz. They are looking to improve access to quality, affordable childcare options through workforce development, leadership development, community engagement, and advocacy. They started the Child Care Coalition during the pandemic as a result of the increased visibility of the childcare crisis in Lake County. I think it's always been a challenge here, but the pandemic really highlighted the need for more quality, affordable, really just any options in our community. The cost burden among counties in Colorado for childcare ranges from 17% to 44%. The DHS recommendation is that the cost burden of childcare should only be 7%, so we're very, very far from that.
I'm sorry, pause.
Yes.
Jackie, what is that?
That's your break.
happy.
Oh my god, that's the kind of lobbying I want more of.
Just for throwing or eating?
Thank you so much.
Wow, that's great.
Sorry, Carly.
And like really well timed. The happiness is, yeah.
We were just talking about food access.
We should be coordinated, yeah. And I know that childcare is one of your priorities, and so this is an area that I'd love to talk more about. It's all of our coalition spaces are spaces where you can come and hear directly from community. And we do really work hard to make sure that those groups are representative and diverse in all ways. So I know that y'all were at the Monday meetings, we go to those too. And we talk to folks who are concerned about the Harrison Park housing development and invite them to join the housing coalition so that it's representative of all of those voices, because we work at the direction of the community with that health equity lens. Youth Coalition is a newer coalition and it's evolved a lot. It initially started as substance use prevention exclusively. And now we're doing a lot more leadership development. We've worked really closely with the school district to make sure that Youth Coalition members get internship credit for working with us. We work very, very closely with all of our nonprofit partners, including Full Circle, who has another youth coalition that's called the Youth Action Squad. And we wanted to make sure that these were really distinct groups so that we're not duplicating what's available to kids, but actually have different opportunities for folks to be involved in. And so together we put on the Youth Summit that's happening on May 8th. I hope you can attend. But the Youth Coalition is different from Full Circles because we're really focused on supporting young people in developing skills to participate in civic life. We want to develop leaders across our communities now who can be the next BOCC members, who can be the next EDs of our nonprofits. We really want to support the resilience of our community and of our economy by giving young people the skills that they need to be successful in these types of roles and to be able to understand, how do I show up and talk about something at a BOCC meeting so that we can have more youth voice included in everything that we're working on. Those are our initiatives right now. And like I said, they shift based on the needs in the community. They're long-term systems change efforts. And so once we've identified a need and we've developed a coalition and we have that collective impact buy-in, we work on these indefinitely, until the housing crisis is solved, until the childcare crisis is solved. But we are able to add new initiatives as needed, which you kind of saw in our history of how we evolved. Previous BOCCs have participated on these coalitions. So Jeff Fiedler was really involved in our housing coalition. Kayla Marcella was instrumental in getting the childcare coalition off the ground. And then various other folks have dropped in here and there to different initiatives because it is a really good space for you to hear from community members regarding all of these issues that are impacting their lives. This just says impact at the top.
You can hide that if you want. Click more, far right,
You have to move the little people in
and
there.
go down to hide floating meeting controls.
Wow. That's so much better now. So glad we did that. I just wanted to talk through a few other things that we've done that you might not know are associated with Build a Generation. So I mentioned the Youth Master Plan. You can see the Senior Master Plan. Parents Active with Schools and Safe Routes to School. Those were programs before my time, but that was some of you might remember the walking school bus initiative to help kids get to school safely. Those routes were developed by us. The community outreach was done by us so that we could help kids walk to school safely. Leaders Latinx. Have y'all met with them already? You've seen them a couple times. They started as an initiative of BAG just like our housing coalition, and it was all focused on Latinx leadership. And now that they have their own resources and support and infrastructure, they are their own entity. And that's similar to Goal as well. A helpful way sometimes to think about, one way that we work is kind of as an incubator space. We know the idea from the community. We have the health equity lens, and then we have the resources to build the right capacity, build the right leaders, incubate the infrastructure so that something can be successful on its own, and then launch it and it becomes its own entity. So that's what happened with Leaders, and that's what happened with Goal before Goal became part of the county. The Community Foundation actually came out of our process because it was in the youth master plan tied to a few of the youth master plan goals. So addressing the financial stability of youth programs and improving collaboration, coordination, and communication among youth service providers allowed us to get the seed funding to start the community fund.
It's great, isn't it?
It's fake wood, well, they're cutting real wood.
Yeah, and that's actually a picture of the tool library, which is a program at the public library that we helped start as well.
It's being able to buy lumber in town.
Too clear, I did not stop.
I know, I'm not saying you
Okay, just saying.
Just
I got so many
waxing
calls.
reminiscent.
I get so many calls like, oh, do you have lumber? It's like, no, sorry.
Really?
Yeah, people call us for quotes to move things across the country.
These are just some more examples. The Unmet Needs Committee I mentioned as a pandemic response effort that really allowed us to coordinate our community and be really responsive and impactful. And I've been in this room when, Greg Lobby has talked about that effort, John McMurtry has talked about that effort. It was really, really powerful and such a good, hopeful example of what we can accomplish together in times of crisis. The Fair Housing Fair is an annual event that we put on. Jackie's really helped out with that. It's in the fall, in September, actually. We have a food summit every year, and these are events that are designed to get more community input, more community involvement, and educate folks about why is it so hard to build affordable housing here? So hopefully some of those elements make your jobs easier. We helped start the Better Out of School Time Coalition, which is still active and supports activities for kids through all of our service providers that work with youth in any way. I mentioned some of these things. The Early Child Care Fund was started through the Child Care Coalition, and we've worked really closely with Adam Ducharme and the tourism panel to come up with a really creative funding mechanism, and I know that y'all took a look at that earlier. That's also being looked at as a model across the state because it is a really creative partnership that will be really impactful in the childcare space. And we started a really great collective impact group that has put on Lake County's first ever Prides. The first one was 2 years ago, and this year will be the 3rd year of Pride, and that is a really good example of collective impact. It's community groups from across our whole county that are coming together to support, whether it's financially or through the infrastructure or setting up the parades. All of those things are happening not just from Build a Generation, but Build a Generation holds the space and maintains the momentum so that stuff can happen. And then most recently we've started those leadership roundtables. We've only had the one, but we'll have the second one on April 7th to try to scenario plan and figure out how we can ensure that folks have the critical services that they need regardless of federal and state policy and budget changes. These are some words we asked our community members to share the impact that they see us having in community, and these are the words that came to the top, which is kind of a fun way to look at it. But I kind of wanted to demonstrate the ways that we partner with government and schools and other nonprofits in town. So here are some quotes from folks. I have Jackie here talking about the support for outreach efforts when a survey needs to go out or we want more eyes on the needs assessment. We have partnered with Jackie to make sure that she gets the information that's most useful to her. You heard from Adam and Passing to A, Carrie Quinlan at the school district, who's been in our community for a long time, focused on health equity, talks about how we sustain the resources to ensure that persistent community issues receive the ongoing attention that they need. We're working on those really tough root cause cultural issues that don't have readily apparent solutions. So just some outside perspectives on the impact of our work. I'll invite Christy now to talk about the storytelling campaign. This was that follow-up from Robert Wood Johnson Foundation from when we won the Culture of Health Award. And then they wanted to fund us to be able to create a model for other communities to show how impactful collaboration can be.
Thank you, Carly. I know it's already been said a couple of times, but I really just want you guys to understand how important it is that we won this Robert Wood Johnson Culture of Health Award. We were the first community in Colorado to be given this award. Since then, there has been some other communities that were funded, but it was really because we were able to demonstrate how, as a community, the government, the school district, all the nonprofits collaborate in such a profound way. I've heard Lake County said that we have a very sophisticated collaboration network, and I think a lot of that is because of the work that Build a Generation does. As Carly said, I used to work at BAG as a facilitator, and now I'm a consultant that is, I'm doing international meeting facilitation. I'm helping nonprofits and small governments all over the country. And a lot of times they want to know how Lake County has done what they have done. And so I want you guys to just like sit in that for a while and be really, really proud of what this community is able to accomplish, has done in the past, and is continuing to do. This particular campaign, which I was just excited to be able to stay in touch with Lake County work while I was moving on to some other stuff, is just a really great way to show everything that we have done since we got this award. So we got this award in 2019, and then obviously right afterwards was when the pandemic hit. And as Carly said, we immediately were able to come together really quickly and meet community needs. There were a ton of people online who were saying stuff like, I want to help, I have resources, I have food in my pantry, and I know that there are people who don't have food, and it was like a little crazy. And so BAG stepped in to be able to coordinate volunteer people who wanted to volunteer, connecting them with all the organizations who needed volunteers, and that framework is still in place at St. George. And so in this project, we have Get Outdoors Leadville, we have St. George, Project Dream, C4, Full Circle, and Advocates of Lake County, just working on collecting our stories in ethical ways, right? We don't want to be telling someone's story just to like wrap up our work, but we really like if someone wants to share their story because they were able to find some joy in their life or get their needs met because of working with one of the organizations. Those are the ways we want to tell stories. And often organizations only tell stories when they need to. And so this campaign, this group was learning how to integrate storytelling as a habitual thing rather than as a one-off type of thing. We've learned a lot. We've been connected with the Robert Wood Johnson Foundation and an organization called Spitfire Communications, who has helped us learn a ton about storytelling. And I think the project goes through the middle of June. So I'm hoping you guys are going to see some stuff from us between now and then. One thing I know for sure that you're going to see is in May, BAG is partnering with the Tabor to stream a couple or to show a couple of films about childcare and also immigration. That's pretty much all I had to share about the storytelling campaign, but I hope that when you guys see it, you will share it with your friends and family and neighbors and just be able to have some pride in all the amazing things that are happening in Lake County. If there's no questions, I'll turn it back over to Carly.
Thank you, Christy.
Thank you.
I wanted to just share like our funding makeup. I think in the last year, I've heard in community just some confusion about like nonprofits and how they work, and so I just wanted to share this just so that y'all know, like we are primarily foundation funded, and because our work has been recognized nationally, we've been able to get some really honestly like prestigious awards from the Robert Wood Johnson Foundation. They don't often give out awards, and we are funded by them, and we're funded by the Colorado Health Foundation, and that makes up the majority of our funding. We do have 2 grants that come from the state. Those go directly into our childcare work and directly into our housing work. We do more work than these 4 initiatives that you see here. So this graph really just represents the percentage between those initiatives. But I'm trying to show that like our foundation funding goes to youth and food. We do have a lot of investments going towards food right now. And then the other 3 initiatives are pretty similar, but those are all coming from foundation funding besides childcare and housing. I also wanted to share the community support that we've been able to provide since we became an independent nonprofit in 2020. This does not include FTE, so this is not staff that I've hired. This is direct dollars that have gone into our community, so it's $1.1 million since 2020. And this is how that's broken up. 62% of that is agency support, so we have passed through dollars to public health. We have passed through dollars to the sheriff's office, to DHS. We provide a lot of support with SNAP outreach, but these are like actual hard dollars that we've passed through to agencies. We've also given money to C4 to run some programming. We've given money to Full Circle. It's all stuff that's aligned with our grant deliverables and with our mission, but we're able to provide so much capacity to our community in terms of training and in terms of the outreach that we're able to do and the coordination that we provide, but also in terms of $1.1 million to our community in 5 years. And again, that doesn't include FTE. The other big portion of that is coalition member stipends. So we really believe in working with experts in the various initiative areas. We do contract with experts across the state and across the country to inform each of our initiatives, but we also really believe in the value of lived experience in our community, and we believe that that deserves to be compensated as we're working towards a solution together. The folks who are closest to the issues have the best ideas to offer, and so when folks are participating in each of our coalitions, we do pay a stipend for that work. And so that's the other big chunk of that that's going directly to community members every year. And then we also support a lot of food businesses. We provide meals at our coalition meetings. We provide childcare at coalition meetings. So we're supporting our local food businesses and other local businesses as well. We kind of broke this down so you could see some examples of different agencies that we've provided support to. And then finally, I just wanted to talk about our partnership. I think we, at least since I've been with Build a Generation, we have not asked for county money. That is, I just heard Elsa previously say that that's not something that is even really a possibility, but we don't plan on asking for funding. We have a very healthy budget. We have a great relationship with our funders, and we like to be able to provide funding to the community in the ways that I just showed. So the partnership that I'm really hoping for is to collaborate through data collection and also data that you need to get out to community members. We have a really broad reach and we have really deep relationships. And I know that that matters to all of you because I've heard you each talk about it differently. Like, you want to be hearing from your constituents and you also want to be getting accurate information to them. And that's something that we do really well through our coalition model. And so that's something that I'd love to offer in partnership. Like, if there are things that you want community to be informed on, let us know and we will figure out a way to help. Whether that's something like really simple an informal, like an announcement at a coalition meeting. Or if it's something a little bit more formal and dedicated, we've run community connector projects where we hire a local individual and pay them to go out into their community where they have even more relationships than we have to communicate essential information. So that's something that we'd love to continue doing with y'all. We do collect a lot of data. We collect so much data to inform our work. And we hire outside consultants a lot to do that because folks do that really well, and we want to be relying on expertise where it's needed. And so if there's data that you're looking for, we likely have it. And so if it's something that you are curious about or have a question about, reach out and we'll try to get you the data that we have, understanding that you may want to look at several other data sources, but it's stuff that we want to share because it informs our work and we want you to have access to that. In the past, we've worked with public health and the hospital on the public health improvement plan. I'm currently on the, I think Julia's calling it an advisory group for the next public health plan. So we partner really closely on that. We partner really closely with the hospital. We do a lot of the survey administration and the data collection and then the formatting to get the report out so that y'all can read it and understand it. All of those are found on our website. And we hope to continue partnering in that way. And I do hope that you'll consider joining some of these coalitions, whether it's just to see what they're about and see who's there, or if it's something regular like previous commissioners have done to really get that depth of information in a particular area. It can be really helpful. Yeah, so my hope is really that we can have that relationship where y'all know what we do, you know what information we might have access to, and you know how we can help you be really effective in your roles by disseminating information or getting people to events. I know we've been really interested in helping the city and county do some town halls because I really believe that we need to be getting together in person in real life to talk about what's happening. We see a lot of misinformation online. And I'd love to set up some town halls so that y'all can be there and answer questions for folks and we can do that so county staff doesn't have to. But I also have heard, well, I know things have shifted now, but I know that there was some other interest in putting on your own town halls, and that's great too. We can also just make sure that the people that are going to that are representative of our community.
Thank you, Carly.
Yeah.
You guys own that building, the old brewery?
No, Full Circle.
Full Circle?
Yes, and that is a common, Full Circle and I, or BAG, we work really closely together. They will do the more direct service work with folks who need things like rental assistance, for example. But then they'll say okay, we really wanna help you sort of get on your feet. And if you're interested in working with our housing coalition to help us solve this problem, here's another way that you can be involved. So we kind of partner like that, and we collaborate on a lot of grants, but we're different.
Do you guys have an office?
Yeah, we're in the hospital, the old hospital.
The old hospital?
Mm-hmm.
Okay. Where the old Department of Health used to be?
Yep, exactly. Yeah, and we shared that space with them until they moved over, and so we were really collaborating every day when we were in that space.
Thank you, it's really informative. It's cool to know that you guys that you're self-funded. I don't think a lot of people know that. And most people, including myself, don't know how any of the nonprofits work, so thanks for sharing.
Yeah, totally. Thanks for having me, and are there any other questions?
But as we look ahead and see turbulence on the horizon with programs, challenges, I guess, the word I should use, with programs the county is mandated to provide. As we run into these challenges, are there areas that you feel like BAG can assist? I think mainly of say we have staff shortages with DHS or something like that. Is there any people on your end who, or if we're like having trouble reaching out or finding how to get our DHS services to the right people, is there like any collaboration or partnership there that can assist? Or, I mean, I don't know the intricacies of each departments like that, but I figure it's worth mentioning.
Yeah, absolutely, and Laura has been coming to the Food Access Coalition meetings
Okay,
and giving updates on like where DHS is at
okay,
right now and really thinking specifically about SNAP enrollment. And so we will like run our own outreach program. We have also previously passed money through to DHS if that can be helpful to fill a gap in funding that y'all have.
okay, that's kind of exactly where I'm like, you know, like, thank you.
Yeah, totally.
Cause I didn't know if there was any connection there, if Laura's already, you know, we're talking to you guys and she's the pro, so she
Yeah,
can explain it better than I can, I'm just like kind of grasping at like straws in the dark here, like, wait, I think is there something there?
Yeah.
That could be beneficial for, mutually, yeah.
And the thing
Okay.
that's really great is because we're so heavily foundation funded, those are private donors. They're really interested in making sure that we're supporting our community as needs arise. And so with this current moment we're living in, they've been extremely flexible with like, we know that, yeah, you're gonna experience some turbulence. You can use these dollars in different ways than maybe you applied for initially, which is just like so flexible and
Yeah.
helpful.
That's huge.
Yeah, and my hope for that next April 7th meeting, the like leadership roundtable discussion, is that we can keep doing the Maslow's hierarchy of needs and then use that screener tool to say what's the effort and what's the actual impact that we could have on each issue, and then who is best positioned to actually provide the resources or capacity to make that happen.
Carly, can you tell me what a housing coalition meeting looks like who's there and
Yeah,
what you
totally.
guys talk about?
Yeah, actually I did I'll send it in an email if that's okay,
I did get an invitation, but it's
Yeah.
always, so far it's been conflicting with other meetings.
Yeah, that's an issue we run into all the time when we try to adjust times based on the makeup. Then you always run into someone can't come. But the Housing Coalition meetings happen on the first Monday of the month from 6 to 8. There's always a virtual option, and the group does change membership. There are like some really consistent players that have been there for a long time, but the idea is that we're having a broad array of folks, both like from, you know, across sectors, like government and developers. We have representation from both of those groups. But then we also have folks who experience housing instability and housing insecurity, or folks who live in mobile home parks, or even folks who are second homeowners. Like, we really want to have the most representation in those groups. And then they have their own strategic plan similar to the one that I shared about food, and that's publicly available, so you could also look at that. Cipriano will send the agendas out in advance so that you can check, like, is this something that I'm interested in right now? Is this relevant or not, to see what they're talking about each month.
Where are the meetings?
At the hospital.
At your office?
Yep, at our office.
Did you guys go?
I haven't been to one in a while though. When we were doing the initial code stuff. We're really close to the coalition. And that's all great.
Sorry, I don't have any questions. Okay, great. Well, please reach out if anything comes up. I'm really excited to work with y'all as you start as commissioners, and I am really grateful for your service to our community. I know I have seen how hard it is. I know that y'all have a big job, so thank you for taking it on.
Well, Tim says you're a good partner, we trust his opinion.
Thank you.
We don't have to, not tomorrow, I don't know what it'll happen. But now, we trust what he says.
All right, thank you.
Thanks, Carly.
Amy, you ready?
We shall resume.
Alright, Amy, you there?
I am.
Alright, great.
There we go.
Do you all see my slides? My slides?
Okay.
Great.
Get back to my.
Let me know if you're waiting for me to jump in or.
No, I think a presentation from Oakwood Homes regarding the housing at 10-2 project led by Jackie Wellahan. All right, Jackie, thank you.
Thank you. So we appreciate your time today. I'd like to give a little bit of background on how we got to today and our conversations with Oakwood. So initially we had put out for proposal, a request for proposal to solicit developers for our project for West 3rd and West 6th Street. We had 5 respondents. The Leadville Lake County Regional Housing Authority chose 3 finalists to move forward. And when those 3 finalists were selected, the commissioners, the previous commissioners, were invited to come down and look at everybody's homes so that they got to see, what the homes being built look like. So it would help them make a very difficult decision. In the end, Adam Berger Development was selected because they really liked the Bonnevilla product. They liked the size of the homes and the quality of the homes. When Adam and his team were unable to secure the financing right around Christmas, the commissioners directed us to reach out to Oakwood, who was a very, very, very strong contender for the project. So we did that the week of Christmas, and they very, very kindly met with us. I would have met with us right before Christmas if I were them. So we've been in conversation with them ever since. They have been fantastic, and they've been, so their business is solution builders, and solution driven is exactly what they are. They have been so great at coming up with ideas, creative ideas, to help us keep on track. We recognized with the misstep with Adam's team that we were behind, and they offered to go directly to Bonnevilla and get the same product that Adam was looking to deliver, so that we could bring the same homes, but with the support of their well-established and very professional organization. So today, I would like to introduce you to Amy Schwartz, who has been our lead contact with their organization, to kind of talk through what we've been talking about and next steps. And Amy, I will leave it up to you now.
Hello, everyone. Thank you for your time this afternoon. We just have about 10 slides, so not a lot. We wanted to save a lot of room for question and answer. So really the intent here is to introduce you all to our organization and our team, and share with you kind of where we're at and what we have ahead of us. So just a little bit about our team, and many of these folks, if not all, were involved in the first proposal, that we submitted and presented last summer. But a little bit about myself. I'm the Vice President of Social Responsibility and Community Partnerships. I've been in this role about a year. Before that, I ran our educational foundation for 16 years and helped develop new schools in and around Oakwood's master plan communities. Since then, I've been leaning into learning more about affordable housing. I'm a student in the first cohort at the University of Denver's Executive Certificate in Affordable Housing program. And I'm also the chair of the Town of Lyons Planning and Community Development Commission. I've been in that role about a year and a half. Bruce Rao is our president of our land company. He's been involved in the project since the beginning as well. And Randy Bauer, I believe, has joined.
Yep, I'm here.
Is our vice president of land development. Randy's been on several of the calls as well. Randy, why don't I just touch base on Don and Blake, and then I'll let you introduce yourself as well.
Sure.
Don Carpenter is our vice president of product development. He's our in-house architect and has been with Oakwood since the very beginning, going on 30 years. He's designed nearly 30,000 homes. And Blake Ayers is our vice president of operations over all construction. And he's been with the organization, I think maybe 20 years as well. So the sum of all the years of this senior leadership team at Oakwood is borders on 100 years. So a lot of institutional knowledge and leadership on our team. Randy, I'll let you introduce yourself.
Yeah, good afternoon, everybody. I'm a civil engineer by school and trade. I was a consulting civil engineer for 8 years before I switched over to the development side. And ever since, I've been doing large-scale master plan amenity entitlement, acquisition, design, and construction. So excited to be a part of this project and hopefully can move forward.
Great, thanks, Randy.
So just a little bit more about Oakwood Homes. We've been serving Colorado since 1991 and closed over 30,000 homes and counting. And that 30,000 is across all of our markets. We also build and develop in Utah and Arizona. We are one of Colorado's largest home builders and community developers. And in 2017, we were acquired by Clayton Properties, which is a company within the Berkshire Hathaway family. All that said, being a part of a large national organization, we still have the culture and flexibility and autonomy to, run the business like we always have in many ways. And part of that is partnering with local businesses, local trades, which is certainly the intent we have moving forward in this project. Most of our homes all of our homes in Colorado come out of our factory where the previous commissioners had visited just north of downtown Denver, where we have used advanced panelization methods for our homes all across the Front Range. And in that, we have an eye towards sustainability and greener products and working on energy efficient homes as we move into the next quarter. So I think I might pause here and just acknowledge there may be a question like, why would Oakwood want to do this project up in the mountains? And I think we are looking towards a new business unit, as Jackie said, solution builders, as a way to expand our business in alignment with our core values, which is opening more doors to home ownership to folks who've been left behind in the market. We are a home builder. Our nation is in a housing crisis. And so we feel it's our social responsibility to really lean in and help get more folks into home ownership in new and creative ways. And so that's really the genesis of Solution Builders, and where we're really trying to be the best builder for our municipal partners. And so when the opportunity for your project came up last spring, we were interested, and as you heard, we were not selected at first, but we're happy to be re-engaged. Some of the master plan communities we have here in Colorado, as I mentioned, really range across the Front Range, from Banning Lewis Ranch down south in Colorado Springs, through Erie and Commerce City, certainly Denver and Aurora with Green Valley Ranch, and all the way up north to Johnstown, our Thompson River Ranch community. As I mentioned, Solution Builders is kind of our newest enterprise focused on public-private partnerships and building upon our passion for opening doors to a better life and democratizing attainable housing. Like everyone should have access, and we know we need to do business in different ways in order to achieve greater affordability and attainability. And we have an organizational goal by 2031 to produce 5,000 homes a year, half of which are attainable by buyers at 80% area median income. And we know we can't meet that goal without public-private partnerships. So I think another reason why we're interested in this project and why we've gotten to this place is because we want to learn how to do this work. And we recognize how much work in Leadville and on the Lake County team have done to get this project to this site where it's ready for horizontal or vertical development, pardon me. Some of the additional programs we have in-house are our sales and marketing team. We have a home buyers club that helps folks get ready for home ownership if they need support cleaning up their credit or just understanding what they're eligible for and having a coach to kind of get them there. That's a service that is at no cost to our club members and no obligation to purchase from Oakwood. Been a very effective strategy, for us and many of those first-time home buyers. We also have an in-house lender, Nest Lending. And we have a partnership with CHAFA, where we're partnering the first lender in the state to have some of our buyers who qualify for the CHAFA down payment assistance and also buy down their rates.
Amy, real quick on that, I think that I'm gonna jump in, sorry for just a quick second. That CHAFA program has become quite, in the circles that I'm in around housing, the idea, instead of just putting down payment assistance, but also getting interest rates down for these buyers, has become a real topic of discussion with interest rates where they are today. And I would commend Oakwood and Solution Builders, especially Amy, because her team has actually pushed that forward at the state level, and it's gotten traction with with Division of Housing and CHAFA. So originally that really wasn't an option. And the other thing too that you deal with rate buy downs is credit scores, particularly because our buyers don't always have the greatest credit score. And so typically the higher credit score you have, the more access you have to a buy down. So having that, I mean, it just speaks to Amy's influence, but having her be able to get the state to even begin to have that conversation is part of the reason that we're doing that with our buyers. And it really makes a huge difference versus $10,000 off a home price versus a 4% on your interest rate is drastically different. And I think it's been really cool to see that come full circle with the discussions that Amy's been having at the state level.
Cool.
So Amy, I don't think you take enough credit for that one. Sorry.
Thank you. Well, it's interesting because our Utah team has been, utilizing the Utah down payment assistance plan, and Nest has been one of their top lenders of that program for a couple of years. And so, it was just kind of like, well, hey, why aren't we doing that in Colorado? So, it took a while, took a good 9 months, but we've gotten there, and I'm excited that will probably that program will keep growing. So thank you for that, Michael. Just a note on our financial capabilities. One of the differentiators for us is we just have privilege and the capacity to self-fund this project and others like this without needing third-party financing. And we have the financial capacity to complete the project in one phase. So, with one less stakeholder kind of at the table, it allows us to move more quickly. I think is an important criteria at this point in this project.
And that stakeholder would be a construction bank, which is the pain in the butt stakeholder.
And they want money for their services.
And it ends up costing the buyers more, so we're very excited about this opportunity.
And so here's the timeline. I don't know, Michael, if you want to walk through this or if you wanted me to, I'm happy to either way.
Sure. And I think it's pretty hard, it's pretty small, so.
Is it? I'm sorry.
Okay. Is there Amy, maybe you could exit your slideshow and just zoom in.
Exit your notes?
Does that zoom in?
No.
No, just exit. Oh, there you go. Okay.
How's that?
That's perfect. Yeah, we'll slide. Thank you. So we wanted to go through the timeline of where we're going. On April 1st, at your next BOCC meeting, you're going to see a professional service agreement with Oakwood. What I would say is, again, this just speaks to Oakwood's professionalism. They have basically been working for free to get the pricing and all the information from the previous builder to make sure that they're able to deliver. Which we had a $150,000 contract with Berger Development. Their contract that'll be coming in front of you is $70,000. The biggest thing to understand about that is there's two kind of big pieces that they can't do in-house. Structural engineering is for the foundations is the biggest, and so they actually have to pay a third-party vendor. The second piece that also is third-party to them is their legal counsel to review the contract, just like you guys have in-house. But so those two pieces, but a lot of what they're doing in-house, as you saw on their team, they have an architect. They're really reducing the costs that we were experiencing with Adam's team to about 50%. And since then, they have been working on that. So on April 1st, we'll be entering into the first step is entering into a professional service agreement. That'll allow us to get the foundation design and final pricing so that we can get going on basically whether or not we can make it work. The other big thing that will be happening in April is a resolution of support for Prop 123. Jackie did an amazing job. So we previously submitted a letter of interest to the state for Prop 123 funds, and we were told no. And we were told no because our prices were too low. Jackie was actually able to go and lobby the state and show them that at our price points that we are still about 40% of our 80% to 100% AMI buyers are putting almost 40% of their monthly income, and that's assuming that they don't have student loans or car payment even. And so the state came back and said they would reconsider. So we will be asking the state for an additional $50,000, so $700,000 for 14 units of the total project for Prop 123. So we'll get into the budget in the next couple slides, but the only downside to Prop 123 funding is that the state, in their infinite wisdom, requires a massive contingency, which is like the cost of 2.5 homes. So to make your budget work, you have to put forward a $600,000 contingency in your state budget that you submit for Prop 123. So we're asking for $700,000 and they're making us show a $600,000 contingency. I don't have control over that, but I just want, when you see these numbers here in a second, you'll understand kind of, I'll talk through, but they're gonna be like, whoa. But a huge chunk of that is contingency.
Is that just for the year? Like, do we submit a
So when
budget
you-
change for the year and then we don't have that on our books anymore?
So you currently do have it, so when we
Budgeted for it, cause it's like, I thought we put aside 1.4 million.
we did, so yeah, you'll see it here in a minute.
Okay.
Oh, that's for this.
Yes, yes,
Okay.
so when we submitted the original LOI, we budgeted it in 2025, because the issue is that when you put in the state grant, you have to hold back the funds in your budget and you put forward a resolution of support. So again, a huge chunk of that money is contingency, which which is also really frustrating to me because you use modular construction to take out a lot of the unknowns, right, with housing construction. Cause you buy the box, it shows up and you set it on a foundation. But they still require a 5 to 7% contingency. So when we get into the budget, I'll dive into that a little bit more, but you'll see where that money shows up. And what it's gonna show up in is we basically kind of double dip in the fact that we are guaranteeing Oakwood, or we were with Berger, to purchase 2 units if we have any attrition in our buyers. But I also will talk about why I don't even think that's gonna be an issue here in a minute. Let's go and run through the timeline and we'll get into the budget numbers, and I'm sure you guys will have questions. In May, the goal is to get to final pricing, and that's also when we submit to Prop 123. And at the same time, that final pricing number is actually really matters to Oakwood and also really matters to the BOCC because that's what's in the contract. So it's basically a not to exceed on the deliverables on the housing units. So we will have a draft contract that you guys will be seeing. At the same time, it's gonna be basically a dual review, because Oakwood also has their own process, internal process, they go through their systems and checks and balances to make sure that they will proceed. So in the month of May, that will be when we're going through contracting. We're also hoping that at that point we'll be submitting the building permits, so we can get the city's approval, as well as the county ComShodas who you guys use, to get that, all the inspections for the modular unit actually happen in the factory as well. And then in May, the submittal of the Prop 123 request is also due. So June will be the big month of go or no go on breaking ground in 2025. At that point in June, we'll know whether or not we're gonna be able to get the boxes ordered, which is the longest lead time, and be able to beat the snow. But our hope is that we're breaking ground and starting foundation work in July, and that the boxes start coming. Basically, the rule of the city is that we can't be in the right of way after October 15th, or October 1st maybe, I don't remember which day it was. But if we're doing foundations in July, we should have all the foundations set, and we should be able to set boxes and be done with setting boxes by November. If we still start in July and we're able to order. So we're really cutting it really close, but we'll know whether or not. And the biggest thing about that too is, again, you'll see at the same time the execution of the contract. We don't wanna execute a contract with Oakwood if we're breaking ground in 2026, because prices are gonna change. And in fact, we'll talk about, we've already seen a 10% increase in the boxes for Montebello since Adam initially started his conversation. We will, at the same time, if we decide to move forward, we'll be executing contracts with the first 17 buyers. And then we will start the process of the second lottery. That takes about 3 months, so we'll advertise it, we'll start taking that. And just a FYI, or we have 189 signed up so far for those last 7 units. So we continue to get people that are requesting to get on that. So I anticipate the second lottery being a much larger lottery for much less units. So we'll be coming back to you in June if we're deciding to go forward this year with another set of lottery guidelines that you'll put forward at the same time. July is the big month. We begin site work and foundations if it all goes to plan, and then in August we get the second round of buyers and we get them under contract. Alright, anything about the timeline? Cause we'll get into the numbers now.
Do you guys have excavators lined up?
They have been talking to local excavators and getting bids, but the issue is foundation plans.
Right.
So that's our current hang up.
Yeah.
So they've been, again, Oakwood has gone out and already started the engagement of EV studios to get on their calendar and start paying for costs, with the hopes of doing a PSA, so that's where we're at.
Would ideally the regional housing authority be running the second lottery, and we wouldn't have to pay for a third party to do that?
Well, that would be great, cause I'm the third party.
Right, sorry.
No, I don't have any, I didn't wanna do the first lottery.
Okay.
I'm not gonna lie.
Great,
So,
just that was one of the reasons we have a regional housing
Yep.
authority, right, and we're hoping to have an executive director, just wondering.
Yes, so the short answer would be great to have them conduct the lottery.
Yeah.
And I still think regardless, I'm here and Jennifer Komodo is here to assist that director with whatever we need to do. So, and at this point, I'm like, all my chips are on the table, so I don't wanna say I work for free, I will work for free, but I will work for free to get this buyer's call.
It's done it before.
I've done it before. So, okay, so jumping into the first slide is the original grant. So this is the grant for all the infrastructure. So the original grant was 1.1, Jackie went out and got another 300, and then Jackie went out and got another 300. So the required match amount of 297 actually was the land. So Jackie, in her infinite wisdom, got an appraisal and then submitted it to the state for the cost of the land that we're putting into the project. And we got a surprise announcement about 2 months ago that the state accepted their appraisal and they're gonna be refunding us our $297,000 match to continue to use on the project.
Not to be used for other things.
So Jackie's amazing, but I mean, that's a perfect example of, yes, Jackie makes lots of cookies. So, but she did, you know, the additional funds that were also committed, when we originally set out, the original total budget for the match for this original grant was 600. So there's always been another 300 sitting there. So that brings us to a grand total of 2 million plus. Then in 2025, so getting to what Lauren was bringing up, the 1.4 that's budgeted, there's two major line items that were in that budget. The county buy down, as well as if you scroll down, which is actually on the second slide, sorry, is the purchase of two units. This doesn't have it on there, but we'll have it on the next slide. This is what we've spent to date. And today, we have a remaining so this is what we have left on our grant. This is what we have left after our refund from the state on the matching funds. Make sense?
No, can you say that again? I'm so sorry, my brain is.
So no, that's fine. So we had a budget of 2 million.
Yeah.
We spent 1.9 so far on all the infrastructure, so we have about 174.
Yeah.
The state.
What's the last one? Yeah.
Yeah,
Remaining one.
so if you go scroll, Amy, if you would scroll back up go up a little bit. So the highlighted, so what
Yeah.
Jackie did,
Yeah.
was she submitted our appraisal. This money is being refunded.
Right.
So if you scroll down, so 174 plus the 297.
Plus that, okay, got it, thank you.
So if you jump to the next slide.
That's why this should increase.
Yeah, because, so. Alright, I think we can see that, Amy, without zooming in, so.
Okay.
Oh, sorry, you're good. So moving forward, this isn't the right budget.
No?
No, that's alright. Let's do this. Let me log on. Sorry, I must have sent you the wrong file.
Okay, I apologize.
No, you're fine, it's my fault.
Can we send it to BOCC room?
Yeah.
I can try. This is good for me. And Outlook, are you gonna email it? Oops.
Sorry, Amy, I sent you the wrong file.
Okay. While you do that, Commissioners, Jeff, would you like to ask us any questions?
Is this for is all of this funding we're looking at, the whole grant is for all 24 units? Cool, so we're not just talking about the 18, this will be for everything.
Yeah, this is for everything.
Okay. Do you have that in
I should.
Wow.
BOCC.
Room.
Yeah.
Lake County City Record.
Okay, that's alright. Sorry about that.
That's unacceptable. That would drive me crazy.
Don't wanna look at mine.
I don't. Uh-huh.
3.5 years got me to 10,006 on red.
Wow. That's great.
Alright, here's the
Wait just a second, do you want me to share it?
Sure.
Now, hold please. Don't tell me, don't Tell me.
Top left.
Dang it, okay. Tell me.
Alright. So actually, this is great. You wanna just do a little zoom, just one click on the out, actually, sorry.
Oh, go out?
Yep. You can see both of them. So actually, here's side by side. This is actually even better. I was worried about them showing up in the slides. So you can see here on this side, this is the infrastructure grant.
Mm-hmm.
So here's the original grant, here's the supplemental, here's the additional money we're getting back. And then these two are the 600,000 that the city and county committed to the project when we put in the grant in, 2022. Okay. Here are the phase 1 lottery buy down, phase 2, so this is the additional funds that are in your 2025 budget for that. And then here's what we spent to date, categorized, and so this is our leftover. Okay.
But when do we get the 650 back? Like, when do we not have to have that?
Well, so,
Okay.
great question.
Sorry.
So, no problem, no, that's great.
No.
These two amounts, when we submit for Prop 123, our required match from the county that we're demonstrating
Right.
is 1.3 million. The contingency amount in the Prop 123 grant is like 600,000 that we submitted to the state. We're double using that in the backfill of if and when we don't, say we did, the 2-unit purchases, if we have 2 buyers that drop out and then we can't backfill, we don't have any more buyers,
Yeah.
then the county would come in and buy those 2 units because Oakwood doesn't wanna be a landlord in the county.
Yeah.
Okay, so that's a way of reducing their risk of building all 24 homes.
Right.
The kicker though is that we've had 189 people sign up, so once we do the second lottery and we have a waiting list, as long as we're able to backfill any units that come off, the county's never out to 650.
I guess what I'm saying is like when that 650 is built into our budget, when does that come off of our like
Out of your,
like I'm gonna call it a liability, like our financial
Yeah.
liability of 650, when
it
does that
would, it would come
end?
off when the houses are finished.
Okay, thank you.
Yep.
So we'll eventually see that leave our budget
Correct.
and people, okay, great, thank you.
The goal is to put that 650 back in the county budget.
Right.
I don't,
Oh, yeah. Yeah.
so going into this year, so this budget, the other nice thing about this budget right here is this is closed out. The state has accepted our final payment on DOLA grant, so the DOLA grant is officially over. So they'll be refunding the 297, and so this is the 2025 budget. So you have your contingency, the 2-unit purchase, so it's kind of a dual purpose, right? There's a major contingency the state makes us hold, as well as the fact that it's in Oakwood's contract that we would purchase to help them. Honestly, that was really in there for Burgers because of his bank. Oakwood is less concerned about this, although they like the idea of that being in their contract, but they're less concerned because they don't have to have a bank. The other big reason for that is because previously, Burger was gonna subordinate the deed restriction to his bank loan. We don't have to do that with Oakwood, which is a huge benefit.
Can you explain that a little bit today?
Yeah, so when we record the deed restriction on the property prior to the sale to a buyer, in the previous model, his construction loan would supersede the deed restriction. So if his developer went under and he didn't perform, the deed restriction would be wiped out, a bank would come in and have free market property, which is not okay. So the way we would have, get way into the weeds here, but we also were gonna require Adam to put up $1 million surety so that he couldn't do that. Cause we would have came in and bought out the bank's loan with that, but that's really in the weeds, but we don't have to do any of that because Oakwood self-finances, which is a huge risk reduction to all of this. So these are your total amounts, so it amounts to actually 1.6 for, the increase from what Lauren said to 1.4 is this.
Yeah.
So you have that additional 300 coming in. The expenditures we have going into next year, we can't do townhome surveys now, we have to wait till the foundations are in to do the surveys. Grading and drainage plans, sanitation, Parkville, patch. The manhole, the sand district came back and is making us, the manhole we tied in the new sewer system to. We were, I don't wanna say dinged, but they came back and said that we now have to replace that manhole as well, which wasn't in the scope that we originally submitted to their engineers. So I guess their engineers missed that, and gave us a nice little bill at the end of the project. So that will happen this summer. We have a retained earthwork, budget, from 5B. Sorry, I was gonna call it 5F. 5B, for the earthwork, so basically this year, after the snow melts, we're gonna go out there, make sure the work is complete, all the erosion controls in place, and then we'll give them the rest of the money. This is for the environmental testing and certification. We have, after the cap is put on, we'll have to pay the environmental consultant to give us our final, all done on the soils remediation. I have a $150,000 contingency in here, as all construction budgets should. And then here are your, two expenditures as they relate to these, as well as the design fee that you guys will be considering on April 1st. So even with that and $150,000 horizontal construction contingency, we still have about 60 grand left over from the original grant budget. Because of Jackie's amazing work of getting the $300,000.
Very kind.
Heck
No,
yeah.
that's really why, because I was prepared to come in here and say we're gonna need more money, so Jackie did an amazing job. But the contingency we have in here, I hope I don't have to use that as well.
Yeah.
But
Okay.
I don't know if an engineer, once we submit building permits, is gonna come back, sand district's gonna tell us we have to do something crazy.
Well, then we're not actually spending, I'm sorry, we're not actually spending the 650, right? I'm just trying to get the math to math.
Yeah, you're actually
So-
not, ideally, you're not,
Ideally.
ideally, you're not spending the 650 in that the 650 is required to be set aside by the state.
Okay,
In case they don't sell.
right, which we would just
Actually, the
sell them
contingency, no, it's not even attached to the sale, the contingency that by the state is if
If somebody falls
If-
out.
the home prices triple.
Yeah.
I don't know. I have fought that one, it's like that, I'm sorry.
It's a lot,
It's two houses.
Yeah.
So of course our budget doesn't work.
Right.
Of course there's a gap.
Yeah.
So you're making me set aside $500,000, which is, so I'm building 26 houses in their budget, not 24 houses. So anyways, sorry. I fight with the state about that one all
It's
the
good to
time.
have contingency.
Yeah, it is, but the price of two houses,
You never know what could happen, and during the pandemic, plywood went up from $8 to $98, half inch OSB.
I was there.
Yeah.
I was building, so.
And building homes, I mean, especially building it through, a board it's challenging and it's time consuming and it's not, things don't go as smoothly as, if you have one decision maker. It's been quite a thing, so.
Yeah. What's not reflected in this budget, which will be reflected in Prop 123, is the 700,000 we get from the state. So if we are successful in getting our Prop 123 award, what winds up happening is we're able to buy down housing prices with that 700,000.
And so that makes those homes continue to be more affordable for future buyers because the deed restriction has a 2% cap per year that you can, earn on what you pay for the house. So if we buy down the purchase price, then it stays more affordable. So we're looking at, with Prop 123 is only for buyers that are at 100% of area median income or below. So we have, right now in the queue, we have 11 buyers that are in that situation. And
We're adding 3 more to the, so when you do, no, because we put 700, we increased it. Yeah. So sorry, we're doing.
No, that's great.
I added 2 more homes. So when you do so what's important about knowing that is, so currently you have 11 buyers out of the 17 that are 100% to qualify. When we do the next lottery, we will have 3 homes available for under 100% AMI. So when you see your next lottery guidelines, there'll be 3 buyers that, when they're selected, they'll be only able to select homes under 100% AMI. But that's proportional to what we saw in the first lottery. The option B would be not to put in a subsidy for the next round of buyers, which I think would be short-sighted.
Yeah.
So we wanted to make sure we had a couple extra homes set aside that would be for those lower AMIs in the next lottery.
And what would we get, remind me what we would get from Prop 123? You said 50?
50 grand a unit,
A unit, okay, cool,
yeah, so 700,000,
awesome,
so 14 units is what I put in.
awesome, 11 for the first, 3 for the next, cool.
So we'll work on the deed restrictions at the housing authority?
Done.
The deed restriction's is done, is ready.
Okay.
Basically, what will happen is that we've been holding off on the actual recording of the deed restriction against the land, just to ensure that we don't prematurely do it in front of some type of financing mechanism. But I don't anticipate that being an issue, but until we're ready to break ground, we don't need to record.
If the house turns over, is that a lottery, or can, like in Frisco, the homeowner can choose to sell it to somebody, which invites a little bit of fraud?
Yeah, so it built into the lottery, into the community guidelines is another lottery situation.
So the homeowner, if a homeowner decides to sell, he can't decide who's gonna sell it.
So here's my personal experience on this one. So this is Crested Butte, and the previous guidelines allowed someone to sell to whoever they wanted.
Right.
And you're right, it's ripe with fraud. Every house, in the first 2 years I was there, I had 2 homes deed restricted homes go, and I sold them to friends. And yes, there was some monkey wrenching going on. And in fact, I put into the new guidelines that it had to go to win a lottery, and then the new comm dev director didn't read the guidelines and told a buyer, who was actually one of my best friends, that she could sell to whoever she wanted. And about 2 weeks went by, and she was like, Michael, what do I do? I'm getting all these calls from folks around town who are telling me they're gonna come by my house and drop off a bag of cash on my front door if I choose them.
Yeah.
She's like, I thought I wasn't supposed to be doing this. And I called the comm dev director and I was like, what are you doing? Like, I tried never to monkey wrench with my predecessors, and like, cause I know they have a tough job. That's one of the few times I was like, wake up, dude. Like, it's in the guidelines. And then, and then she wound up getting screwed over because she hired a real estate agent, and then she had to pay a commission. So the town, anyways, that's why you don't do that. To your point exactly, it will happen 100%. And it's really great, to be real frank, it's really great for the seller, because all they gotta do is pick up the phone, call the regional housing authority, and they list it for them.
So these houses are actually gonna become cheaper over time at a 2% appreciation cap, whereas everything else is gonna appreciate by 9 or.
Yeah.
Unless there's a housing market crash, but
I wonder if those houses in Frisco, the Wellington neighborhood, were built 25, 30 years ago at a 3% cap. I wonder what they trade at. 300,000, 350, something like that. So that's kind of cool part of it.
Yeah,
They're gonna become really coveted.
And that's the intention, is to keep them affordable for next buyers, so that we're not doing all of this work for the first round of buyers, but that it continues forward.
when I started the whole housing thing in 2012, the idea was that it was a starter home and someone was gonna move out of the home, get the equity that they had and buy a free market house, and it was gonna be freed up. Never happened.
People just stay.
The only reason that anybody ever sold their house in Crested Butte is, I hate to say it, they either died in an avalanche or they couldn't breathe any longer.
Or
I know,
Literally happened.
which literally happened, sorry. I mean,
Or they inherit a bunch of money.
Yeah, wait, speaking of inheritance, can you pass it on to your children? Like, what is that?
so they can, but there's rules around that.
Sure.
In that, and I didn't do your guidelines, but I wrote the original guidelines.
Yeah.
If your children take on your house,
Yeah.
they have to live in it and qualify they have to work and live in Lake County. They can't they can't live in New York City
Yeah,
and rent it and make income. So if they're not gonna occupy it like any other local would, and that qualifies, then they have to actually sell it and they'll get the equity out of it, but that's it. But then it has to go to market.
okay.
Great
Oh,
questions.
yours.
Yeah, these are all great questions.
What if you don't qualify based on your AMI?
Then you have to sell it.
Okay, but so it gets passed on through your inheritance, but then you have to sell it. So you do get equity.
If you don't qualify,
Like, what if
then
you-
you don't get it, right?
No, I guess I mean, like, say, like part of owning a home is also being able to have people access generational wealth. And by wealth, I don't mean like uber billions, I mean like stability. So if, say somebody dies in one of these homes, from old age, and the home is owned by that, I'm sorry, my brain is so tired, but the home is owned by the, you know,
The parents.
the parents. And then you're the beneficiary of that equity.
If the kids don't wanna come back and live in the house, then what they do is they call the housing authority.
Yeah,
The housing authority lists it for that 2% appreciation.
yeah,
Whatever's owed on the loan, the bank gets paid first, whatever's left over the kids get.
okay, cool.
Yeah.
So they get the equity out of it, they get the
You
generational
get the 2% per year.
inheritance out of the equity.
Plus whatever their parents have
Paid on
managed
interest,
to
Right.
pay off,
or not the interest
Right.
principal.
which is probably loaded way up front like everything else. Yeah.
Cool,
So I want
just
your
wondering.
parents to last at least 30 years,
Yeah,
get that sucker paid off.
Yep.
cool. Thank you, I never
No.
asked that question, never even
That's fine,
thought about it.
that's great. Amy, do you have anything else you wanna add?
I don't, I mean, just again, I think the essence of a really strong public-private partnership is aligned interests, shared learning and a little bit of shared risk. And so that's how we are approaching this, and we're really excited about it and appreciate working with this team and learning from them, and hope to continue this journey.
And I'll just give again kudos to Oakwood, like a perfect example of learning from this is like on Thursday, I'm meeting with their financing team to teach them about Prop 123 and the worksheet that I've had to like have a master's degree to figure out. But it's been great to have them really be diving into being a partner in that they're willing to put forward hours of staff time, which is real cost to them, just to make sure that they understand everything that's going on. So, I mean, I don't even wanna guess how many hours they have already spent with me and Jackie, and they don't even have a professional service agreement. So it just really speaks to the professionalism that they have and their actual commitment to advancing their goal of doing half their homes, 2,500 a year, that would be affordable to other places in the state, so.
Well, thank you guys for coming
Awesome.
back
Yeah.
after not getting selected the first time.
And from that standpoint, when you saw their slides about their marketing team, their team that can help support us is phenomenal.
Yeah.
Our previous experience was not great, and we didn't feel well supported, and like Michael's talking about, I mean, they've been working tirelessly since December to try and help us stay on track to make this project a reality. And it's exciting.
Yeah, there's a bit of a philanthropic piece to the view on this, which is cool.
It is, it's cool, and it's been, as someone that's been sitting in their boardroom and talking with them, like, they have a very, like, they build efficient, they build fast, they know what they're doing, they built 30,000 homes, right? And so when I'm like, when we're walking through the fact that this is a partnership, and they're like, well, who's put, like, we don't have a water tap in here, I'm like, no, we did that, and they're like, what? So it's like this learning the partnership, like, because they normally come in as a developer and then they go through the developer wood chipper. And I think this has been really fun to work with their team on how this model would suit. And I also think sorry even to say this, but I also think that I've seen light bulbs go on like, wow, this could actually be profitable, not like uber profitable, but there's
There's a margin.
there's a margin here that makes this viable for other places in the state,
which is great,
which is what we want.
cause otherwise,
That permit number seems really low, are we getting a discount?
which line are you on?
Permit inspections.
Building permit?
Building permits and inspections that seems super.
That's for all 24.
Yep.
We're getting a deal, obviously.
And we should not be getting a deal because it's all third party, so if that doesn't look right, then we need to look at that.
We might need to look at that, but I believe that's the number I got. We actually priced it with the building permit.
Okay.
But let me.
I would just mention that I think that, that I think the difference there, Matt, a little bit is that we'll be doing a master plan set review and then the individual permits. So I think we did look at it together. I just wanted to jump in there.
Thank you, Anne.
Okay.
Okay. Alright, well, that was 50 minutes, sorry. 51 minutes.
That's great.
So,
It is hot
so
here.
we'll be back before you on April 1st.
April 1. It's just so you know, it's
So
April
close.
Fool's Day. There might be some
So,
shenanigans.
dear.
Can't wait.
Thank you, Amy.
Thank you, Amy, so much.
Thank you all for your time. Take care out there.
Okay, sorry, will you announce this, please?
It's 3:51, we're gonna close today's work session, of Lake County Board of County Commissioners. Thanks, everyone.
With the
Thank you, Andy.
If that's the
Thank you,
case,
Commissioner Elsa.
then you and I can sit down, whenever we get a draft.
Okay, I have to go outside.
Are we still
For 5
recording?
minutes. Oh, no, it's,
You can end this one.
I pushed stop. Oh,
That's not gonna happen.
don't tell me, let me see if I can.
We're not gonna get to that.
Yeah.
And so it's like our audio is
So-
still picking up. Not sure.
Really,
Yes.
supposed to do the pre-construction and then work